swear in a new chair in just a moment. I'm going to ask our current vice chair to call the meeting to order. You're on mute.
Muted.
Yeah, you're muted. There you go.
The meeting is called to order. Welcome, everyone.
Okay, do you want to ask for a roll call, Molly?
Yes, I will.
Okay.
Amy will call the roll, I think.
Yep.
Myra Alvarez,
Present.
Nadine Burke Harris,
Present.
Monica Fitzgerald,
Here.
Shayna Hazen,
Present.
Jackie Majors,
Here.
Elsa Mendoza Jimenez,
Here.
Molly Munger,
Here.
Chris Perry.
Here.
That's great. Thank you so much. It's good to see all of you, even again on screen, yet one more time at least. It's my pleasure today to have the honor of introducing our new chair for the First Five Commission and our newest commissioner. I'm going to just say a few words, and then Molly will go ahead and swear in our new chair. So with that, like I said, I'm so excited to introduce our new commission chair, Dr. Nadine Burke Harris, California's Surgeon General, and our new commissioner, Elsa Jimenez. So by way of introduction to someone who now needs no introduction, Dr. Burke Harris was appointed by Governor Newsom to be California's Surgeon General in 2019. She was the founder and chief executive officer of the Center for Youth Wellness from 2011 to 2019, and founder and pediatric medical provider for Bayview Child Health Center from 2007 to 2019. She was the medical director for pediatric health parity programs from 2005 to 2009. She is a clinical instructor, or was, for the Department of Family and Community Medicine at the University of California, San Francisco, and co-instructor of record for the Stanford University School of Medicine since 2003. Dr. Burke Harris was a research fellow at the Harvard School of Public Health and a research associate for the California Workforce Initiative of the Center for Health Professions at the University of California, San Francisco. The list goes on and on, actually. I can't believe you've done all of that in your short 20 years, so amazing. So I would ask that you please join me in welcoming Dr. Burke Harris.
Indeed. Yes, indeed. I think that a lot of us here today have a special fondness for Dr. Burke Harris for her wonderful work on toxic stress and its lifetime effects on children. And so she comes to us as the godmother of a whole branch of knowledge and understanding that we very, very much appreciate. Thank you so much, Dr. Burke Harris. Now it's my great pleasure to swear you in as chair of the First Five California Commission. So if you will, I guess, raise your right hand and repeat after me. I state your name, do solemnly swear or affirm
I, Nadine Burke Harris, do solemnly swear or affirm
that I will support and defend the Constitution of the United States and the Constitution of the State of California
that I will support and defend the Constitution of the United States and the Constitution of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I will bear true faith and allegiance to the Constitution of the United States
that I will bear true faith and allegiance to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion,
and that I will well and faithfully discharge
and that I will well and faithfully discharge
the duties upon which I am about to enter.
the duties upon which I am about to enter.
Congratulations, welcome, and I'm so glad now to turn the meeting over to you, Dr. Burke Harris.
Thank you so much. There's something about taking that oath that always reminds me of getting married, right? Like it's really, it's very powerful. It's very resonant. So thank you so much, Molly. And it is now my privilege to swear in our newest commissioner, Elsa Mendoza Jimenez. Camille, do you have any words of introduction about Commissioner Mendoza Jimenez?
Yes, I do. So thank you so much. So at the same time, Dr. Burke Harris was appointed, Governor Newsom also appointed Commissioner Mendoza Jimenez to serve in the public health position on the commission. She has been the Director of Health Services for the County of Monterey since 2016. She held multiple positions for the County of Monterey from 2001 until 2016, including Assistant Director of Health, Management Analyst 3, Health Program Coordinator, Senior Health Educator, and Chronic Disease Prevention Coordinator. Ms. Jimenez most recently served on the First Five Monterey Commission. She will bring her public health background as well as the perspective of a county commissioner. And I can say I've heard from First Five Monterey and they are very sad. They're not mad at us, but they're very excited for the state, but very sad to lose you. We look forward to working with you to implement the commission's vision and strategic plan. So please join me in welcoming Commissioner Jimenez. Yay.
And now it's my privilege to be able to swear you in. If you could please raise your right hand and repeat after me. I state your name.
I, Elsa Jimenez. Oh, sorry.
It's okay. Do solemnly swear or affirm
Do solemnly swear or affirm
that I will support and defend the Constitution of the United States
that I will support and defend the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion,
and that I will well and faithfully discharge
and that I will well and faithfully discharge
the duties upon which I am about to enter.
the duties upon which I am about to enter.
Congratulations!
Thank you.
That's great.
Wonderful. And I understand that now is a moment where I have an opportunity to make a few brief remarks. And I'm very pleased to have an opportunity to introduce myself to you all and to be joining you as the incoming chair. I want to express my thanks to our outgoing chair, George Halverson, who has been a friend and a partner in supporting the health and well-being of children. And I would love to share a bit about myself for those of you who don't know me. For those who don't know me, I am a proud immigrant. I identify as Jamaican. I was born in Canada of Jamaican parentage, and my family immigrated to the United States from Jamaica when I was about 5 years old. And I was very proudly naturalized as a US citizen actually in 2009. My husband and I have a blended household with 4 beautiful boys, 2 adopted and 2 biological, which include twin 17-year-olds, an 8-year-old, and a 4-year-old. So I'm also a constituent. And my garden is my obsession. So I spend a lot of times on the weekends digging in the dirt with my kids and making jam and pickling and all of that kind of stuff. Professionally, as you heard, my background is as a pediatrician, a researcher, an advocate. And my passion has always been in addressing health disparities and working with vulnerable communities. I think you heard a little bit about my background as a clinician and a researcher. And one of my big goals coming into the role of chair of First Five is really to bring a strong lens of the latest science, the latest research about how we improve the health and well-being of children at scale. To this body and to the work that we're going to do. And I'm very excited to partner with you all to do this work. So I'm very, very pleased to be here and looking forward to doing lots of great work together. And now, Camille, if you would want to give a brief overview about how the virtual meeting will be conducted.
That's great. Sure. Thank you so much. And thank you. I keep looking at the screen when I'm supposed to be looking at the camera. So forgive me if I'm not looking at, I really am trying to look at you, but I forget sometimes. So just to go quickly over how we're going to conduct the meeting today, including the facilitation and discussion amongst commissioners and public comment. First off, if anyone who's listening or any commissioner is having technical difficulties, if you'll send an email to info@ccfc.ca.gov. We have staff standing by on hand now to immediately assist you to take care and hopefully solve those issues if you're having them. Commissioners, to eliminate background noise, and you've all been on now many Zooms, and I can see that. It's helpful if you could mute yourselves during presentations. Upon each agenda item, you'll be able to provide feedback and questions. You can do it 2 ways, either by using the raise hand function on the Zoom, or if you physically raise your hand, we'll be watching and able to call you out to make sure you have an opportunity so that the meeting moderator can make sure you have that opportunity to speak. Jamie Hastings is going to moderate that list and make sure that all of you have the opportunity to speak and comment on each item. Voting is by roll call vote on all items now in that same manner as our prior virtual meetings. Jamie will call when asked, Jamie will call roll for each commissioner for those items. For the public, the general public, the public will be muted during the meeting. And so just like normal in-person commission meetings, if we can remember those, it seems like a long time, but the public will have various opportunities to provide public comment, again, by using the raise hand function on the Zoom webinar. This will allow Jamie to identify who wants to speak. And at that point, Jamie will call on the attendee and she will unmute their line in order to allow them to provide a 3-minute public comment. First 5 California staff will also be muted at the start of the meeting, and they will only be unmuted if they're presenting an agenda item. They could also be called on if commissioners have questions during the meeting, and clearly we'll unmute them and they'll provide information. So one more time, if anyone's having technical difficulties using the raise hand function or anything else, please email us at info@ccfc.ca.gov. We have staff, as I said, standing by, ready and able to help you. So unless there are any technical questions, we will get started with presenting our items. Any questions, commissioners? No? Okey doke. Chair Burke Harris, should we get on with the show?
Yes, thank you, Camille.
Okay.
And now I'd like to announce that if any agenda item presents or potentially may present a conflict of interest for you, please let me know. Obtaining this information in advance will ensure that I can announce your non-participation in any aspect of that item in compliance with applicable laws. Does any commissioner want to state a conflict on any of the items?
Yes, good morning. This is Commissioner Jimenez. I would like to recuse myself from voting on consent calendar item 3C, as Monterey County is one of the 16 counties participating in this pilot, and the Board of Supervisors has yet to accept my resignation from our local First 5 Monterey County Commission.
Thank you. Any other recusals? Hearing none, we will now have an opportunity to hear updates from Camille Mabin, Melissa Stafford Jones, and advisory committee members.
Great, thanks so much. So first of all, Happy New Year to everyone. Yay, 2021 is here. If you would have told me last year that we would still be meeting virtually in January 2021, I would have thought you were crazy. But here we are, and before we get started, I wanted to take an opportunity to call out several First 5 California staff. Jamie Hastings, Simon Marquez, Paul Waters, Riley Henderson, and Simone Afghari for all the work they do to coordinate and facilitate these commission meetings. There's a lot of work that goes into that end of it, and they make it look really easy. So I just want commissioners to know, and I just want to publicly say thank you to them and how much we all appreciate the work that they're doing to make these meetings happen. So thank you very much. There you go. Moving on, starting last October, commissioners, if you'll recall, we provided you with a personnel report as we were requested. It was a commissioner request at the quarterly meeting, and we'll be doing that at each quarterly meeting. The full report has been included in your meeting materials, but I wanted to introduce you virtually to a new employee that we have on board. I am pleased to announce we have a new Deputy Director for the External and Governmental Affairs Office. Max Vargas will be joining our team next week. So let me just tell you a couple things about Max. Prior to coming to work with us, Max was the Senior Policy Advisor to Mayor Michael Tubbs in Stockton. He has a long history of, during that time, of working at the local level with both city and county government. He also knows First 5 San Joaquin well, as they did a lot of work with them. He also has worked in the Capitol on both the Assembly and Senate side. Max is an attorney. He speaks 3 languages, and he and his wife, probably most importantly, are the parents of 2 daughters under the age of 5. So he is really in the thick of it. Max will oversee the legislative, policy, public relations, and communications staff. He is joining us virtually. I asked him to join us virtually this morning to introduce him to all of you and have an opportunity to say a few words. So I am going to ask Simon to unmute you, Max, and let you introduce yourself to the commission.
Great. Thank you, Camille. Good morning, Madam Chair and commissioners. It's a pleasure to be here virtually, even in advance of my start date, so I get a chance to meet all of you, at least virtually. As a father of 2 little ones, as Camille said, a 4-year-old and an 18-month-old, in fact, and a longtime policy staffer that's been focused on equity, that's been focused on early opportunities and opportunity agendas. I'm so excited to be joining the First 5 California team. Much like Dr. Burke Harris, Madam Chair, how you shared your proud immigrant, I am as well. And in many regards, for me, this brings a lot of my own personal story full circle. At age 5, as an unaccompanied minor, I fled terrorism in Peru, immigrated to this country, and was thankfully reunited with family, eventually granted asylum, residency, and years later became a naturalized citizen. And, you know, I like to say that at times I was unaccompanied, but I was not alone. And I think of that as kind of my own personal trajectory, knowing that I benefited from a number of support structures, both family, community members, nonprofits, educators, health clinics, and institutions throughout. And I think it's that beloved community, as Dr. King phrased it, that gave me the opportunity to thrive. It's why I've been committed to public service. It's why I've done the work through both the state legislature, through local agencies, through local officials, to bring opportunity where it's needed most. And what better place to do that than with our young people and with our children. So I look forward to bringing that breadth of professional and personal experience to ensure that California's greatest assets, its children, have all the opportunity in the world to thrive and succeed. So thank you for the opportunity. Thank you, Camille, for giving me the chance to introduce myself early on and get to see our new chair and commissioner seated. And I look forward to working with all of you.
Thanks so much, Max. Before we let you go, I'm just going to ask if any of the commissioners have questions or comments. Now, you know, just before we let Max go. Just looking. Okay. Shana?
I do. I just want to welcome you, extend a warm welcome, and really appreciate you sharing your story and how your own experience will inform the policy work we do together. And I'm really glad to have you on the team.
Thank you. Appreciate that.
Great. Well, you will see Max from now on at our meetings and in between. And I know we're all excited here to have him on board. So thanks so much, Max. One other hire just to call out that was included in your report. We recently hired Jalal Haddad, who we hired him as a health program specialist 2 in the training and continuous quality improvement office that he'll be working closely with Debbie Silverman. He comes to us from the Department of Healthcare Services, where he's worked for more than 12 years overseeing an array of the department's Medicaid, home, and community-based service programs, enabling people to be served in their own homes and communities rather than going to an institution. Jalal will manage and guide the health and family support related responsibilities prioritized in our strategic plan. He is due to start with us about a month from now, March 1st. So we look forward to working with him, and I'm sure you will have an opportunity to see him in the future. There are other few folks on your personnel report that you can refer to, but we are in the process of trying to get those positions filled to give us a little more capacity in the work we're doing. So now I just want to spend a couple of minutes talking about some of the program work, just to give you a little bit of an update. So the first is the Early Childhood Educator Workforce Study. First Five California has a contract with the Center for the Study of Child Care Employment at UC Berkeley to carry out the California Early Care and Education Workforce Study. So this is Marcy Whitebook and her team. This is a follow-up to their seminal findings, but from 2006, where they last collected comprehensive data about the demographics of providers working in the ECE profession. That report, I will say, has been used time and again. The information and the data collected has been used time and again over the years to inform policy, to inform recommendations. So 2006 now was a while ago, so it is time, we believe, to bring that data up to date. All well and good. However, soon after the contract was executed, COVID-19 caused them to rethink the purpose of the study and data collection methodology, which turned to assessing the impact of the COVID-19 pandemic on ECE programs and the workforce, and also to assess supports needed by programs and the workforce during this critical time. In their collection of data, they received, put out a survey, and they received an unprecedented response from more than 1,600 early childhood directors, 2,800 center teachers, 2,300 family child care providers, and 285 TK teachers. So really an amazing sample size filled out the survey. We at First Five California funded the data collection portion of this project through the end of January, after the California Department of Education had funded the development of the survey tool. UC Berkeley also has other funders who will support the next phase of the study, report writing and dissemination, which will all take place over the next year. This has really been a collaborative effort. In fact, tomorrow, First Five California, the Department of Ed, and other funders have a call scheduled with the researchers to learn about the preliminary findings and we're anticipating that we ask them to come to the commission soon and report on what they have learned. So look forward to that. I think it will be really important information. Speaking of collecting data, the next thing up is to talk for a minute about what we're calling a data digest. We've heard from commissioners at past meetings and retreats that we need to find better ways to understand progress for children and families in our priority areas and for our priority populations using valid and reliable data. In response to the Commission's questions and their guidance, and we're working to develop a more robust monitoring system and thinking about ways to better track information and make connections between strategic plan implementation and the results at the policy systems and population levels. Specifically, we are exploring ways to develop a data digest that will allow us to look at relevant population level and subpopulation level data for context and present related performance measures about our investments through an equity lens. This data digest will also enable us to view performance measures in relation to our strategic plan priorities and really to tell the story of the impact First Five California investments are having for young children and their families. So over the coming months, we'll be working with our Strategic Plan Advisory Committee to inform the work, as well as all of you. We will be utilizing our contract with Child Trends to help us develop an equity framework and engage partner and stakeholders on how best to design the digest to serve multiple audiences. We're excited about the work. Our plan is to come back to you in April to give you another update on the progress with more specificity and details, and obviously to allow you the opportunity to weigh in as well. One of the other things that has been, one of the other many things that's been going on, just to bring you up to speed, is we're getting close to closing out our emergency supply update. So after many months, the partnership with supplybank.org is coming to an end. The final statewide shipment of emergency supplies went out in December, and we'll be closing the contract out at the end of February with a few final requests from counties to deliver supplies because of limited or specific needs that they might have had. As of January 2021, you can see the graphic up on the screen. The following slides have been dispersed. So pretty amazing. 6.6 million adult and child masks, for example. 6.3 million diapers. That's a lot of diapers, and even more wipes. So, you know, I'm not going to read each one of them, but you can take a look. Clearly across California, First Five California has helped providers with those most essential needs in caring for their young children and families. So we'll provide a final report to the commission at our next meeting that summarizes the highlights of this investment. So, and finally, we want to express gratitude for the great work being done locally so thanking our First Five County partners who really are the boots on the ground that are getting these supplies out statewide. Simon Marquez and I had an opportunity last Saturday to be part of First Five Sacramento's emergency supply distribution event, where we saw 350 providers line up to go through a drive-through to pick up their supplies. And I have to say, it was just an overall good feeling to be part of that and to see the final result or the help that is so appreciated by the people who are doing this work. So that was exciting. We also want to thank for sure our folks and our partners at supplybank.org for all the work they've done on this one. Just a couple more things to bring you up to speed on our family engagement toolkit. So we're happy to announce that the 3 remaining modules of our online family engagement toolkit, which is funded out of our impact funding, will be released in February. All the modules and supporting documents are both in English and Spanish. If you'll recall, the first 2 modules of the toolkit were released in February of 2020. So this release next month will complete the toolkit. If you'll recall, it was designed in partnership with the Brazelton Touchpoints Center. The toolkit is a completely free resource for early learning and care providers to build on skills and family engagement strategies and provide techniques that can be implemented in everyday situations. I've gone through the modules and they present a situation, they ask you what you would do, they give you some strategies about your choice. Maybe you could have done it this way, or give you some extra support, or if you don't know, how maybe to start conversations with parents and engage them. So we're excited. It's online. Providers can go on at their convenience and use this tool. Finally, home visiting. We're pleased to announce that all 50 contracts for home visiting coordination activities are fully executed and counties have begun the work. If you'll recall, the purpose of the funding is to help counties coordinate home visiting services and embed home visiting into the broader system of child and family supports, with a focus on making sure services are coordinated to help families recover from COVID-19. First Five California is contracting with leaders from the Home Visiting Applied Research collaborative to provide technical assistance to county agencies. And more than 140 people participated in a webinar in the beginning of the month, which launched these technical assistance plans. Both the home visiting and coordination work and the home visiting workforce study, which you'll hear about a little later on from Child Twins, are implemented in collaboration with departments of social services and public health, the First Five Association, and First Five Los Angeles. It really is a great partnership. And just finally, to round out a little bit about our Foster Bridge study. If you'll recall, we contracted with the Child Care Resource Center, who continues its work on the California Emergency Child Care Bridge Study, AKA Foster Bridge Study. The study evaluates the success and challenges county staff and families face during implementation of the Foster Bridge program throughout the state. The purposes of the Foster Bridge program are to, 1, stabilize children in foster care with caregiver families at the time of placement by providing a time-limited payment or voucher for childcare, and 2, to provide the caregiver family with a child care navigator to assist them in accessing long-term subsidized childcare, and provide trauma-informed training for childcare providers serving foster children. We are the funder of the family results portion of the study, and we're collaborating with the Heising Simons Foundation, who's funding the implementation analysis, as well as First Five San Bernardino, who funds the trauma-informed care evaluation. So again, working with our partners throughout the state to support young children and families. So that's my report for this time. We're doing lots of work, as you can see, and just wanted to bring you a couple of highlights this morning. So if you have any questions, I'm happy to answer them, but that's my report. Any questions?
I do. I have a question. Camille, thank you so much for that report. In terms of the trauma-informed training for foster care providers, who developed and who is implementing that training?
That is with Child Care Resource Center, who is a large contractor out of the Southern California,
Camille, I'd also like to add that although CCRC is contracted for that work, they're also working with Drew Child Development in Los Angeles, who has done work with mental health and support services for years. So within our Child Care Alliance of Los Angeles, they are targeted with their practitioners developing, executing, and training on that curriculum.
If there's anything you would like to see, I'm sure we can provide that curriculum to you. Happy
I'd
to
love to see it. Thank you. That would be great.
Not a problem. Other questions? Shayna?
Yeah, so I'm curious about I'm not gonna get the name right, the toolkit you described. You said it's online, it's available. How are we making sure that providers actually access it and know about it and use it?
So we're doing it in a couple of ways. One, through our Quality Counts California website, our programs through the consortia members, getting the word out there, getting the word out through our listserv, asking our other partners, making sure they know, as in Department of Ed and now Department of Social Services. As you probably, I don't know if you know, but many of the programs, childcare programs, are being transferred from the Department of Education to the Department of Social Services come July. So we are more and more including Department of Social Services in our conversations, as our work is going to shift as well to work more directly with them. One piece of, I think, great news is the new Director of Child Development at the Department of Social Services is Lupe Jaime. So one who knows us well. And so we're excited that she's excited to be there, and we look forward to working with them as in the transition, as well as continuing our partnership with Department of Ed. But
That's great.
in any of those listservs, any ways we can get that out, that's what we're
Yeah,
doing.
and I would just ask, and this ties back to it, I'm very excited to hear there's going to be a data digest. But I'm curious, are we tracking utilization of the toolkit, or can we, so we know how effective is it? Are people using it? Are they finding it? That would be great.
Okay, thank you. We'll make sure. Anything else? Okay, I think that's it for me. Oh, any public, Dr. Burke-Harris, do you want to call for public comment?
Yes. Do we have any public comment?
Hold on. Yes, Hugo Morales.
Yes, we do. So
Hugo Morales, we'll see you in right now.
Yes,
Go ahead.
This is Hugo Morales. I'm a commissioner from Fresno. So I want to congratulate Dr. Nadine Burke-Harris for your leadership. I know you have many, many people. You've met millions, but I met you when you were at the Bayview Clinic and you made a presentation to us. And I was at that time a trustee of the San Francisco Foundation. So it was our staff and trustees who joined to hear about your great work and your pioneering work. So we've been following your incredible career. So congratulations. It's just, we look forward to your leadership. I wanted to address two areas this morning to the commission. One is I would hope that your policy committee considers supporting efforts to provide broadband to all our rural and low-income families in California. This is something that others know, that I've been coming to the commission now for over 10 years, suggesting something like this. So I would hope that your committees look at that. It's so critical. I mean, it's so obvious right now, obviously, with the pandemic, and I need not go further than that. The second item is something, Dr. Harris, Burke-Harris, that you alluded to, and that is research. And one of the things that I want to share with you is that as a commissioner, our first 5 here in Fresno County, we commissioned Hardware & Company. I think some of you may know the firm from the Bay Area, to do follow hundreds of our low-income families and study the impact of reading to children and books, and also early childhood learning, and the impact of that and the academic achievement by the 3rd grade. So that study just happened, and I'm hoping that our staff will forward that to you, commissioners, so that you may learn of the specific research, which affirms a lot of the messaging and messages and a lot of literature you have been promoting as a commission. Thank you very much.
Thank you.
That's all the public comment we have.
Wonderful. And now we will hear from First Five Association Executive Director, Melissa Stafford Jones.
Thank you. Good morning, commissioners and Camille. Congratulations, Chair Dr. Burke-Harris and new Commissioner Mendoza Jimenez. Thank you for the opportunity to speak with all of you this morning. At the last State Commission meeting, I had the opportunity to discuss with you some of the systems change efforts at the local level that aim to shift the conditions that hold barriers, problems, or inequities in place, or that don't fully center the strengths and needs of children and families, so that we can make progress toward our shared goal that all children are safe, healthy, and ready to learn so that they can thrive in school and life. And one of the examples we talked about was around the positive impact we have seen locally of home visiting and the critical role of those local efforts in informing state policy. And this linkage, this bidirectionality between local work and state policy contributed to efforts to expand home visiting and showed how state leadership is critical to creating opportunity for more children and families to gain the supports they need that we know increase family resiliency, connect families to other services and supports they need, a range of those from Medi-Cal to developmental services system, child welfare, mental health, childcare, and important basic needs such as food security, housing, and employment. And in this way, home visiting truly embodies the whole child, whole family prevention frame that is core to First Five and that lays the foundation for the health, safety, and well-being we want for all our children and that we know is foundational to early learning goals. And as we look ahead toward our ongoing partnerships and opportunities between our work at the local and state level as First Fives to advance our shared goals, I wanted to highlight today some of the key ways at the local level in which we are seeing health-focused work as core to the whole child, whole family approach, particularly when it's grounded in centering equity. These efforts aim to center young children from underserved communities, recognizing the interconnection of physical well-being, social emotional development, language and literacy development, and cognition, and really our efforts to put into practice the knowledge we have that health and well-being are critical to successful academic learning, and that trauma and adverse experiences negatively impact a child's ability to learn. And of course, that's importantly recognized and highlighted in the state's master plan for early learning with its centering of equity. Some of this work at the local level I want to share with you is rooted in partnering with the health system itself, and other initiatives are anchored in the broader social determinants of health, but it all aims toward improved health in a holistic framework. And in sharing some of those local examples to advance health and equity in a whole child, whole family framework, I thought it might be important to just pause for a moment and take stock of our starting point together. As you know, California is home to over 9 million children, of which 3 in 4 are children in color, and half have at least one immigrant parent. Overall, children of color have higher rates of low birth weight, asthma, hospitalizations, homelessness, face racism, and poverty, all of which negatively impact health. And in addition to physical health impacts, the effects of structural racism and discrimination can be detrimental to the mental health of our children of color who have report experiencing discrimination at a young age, facing higher risks for anxiety, depression, and a range of other mental and behavioral health concerns. And we know that racism impacts maternal health as well. Black women are roughly 4 times more likely to die from pregnancy-related causes than women in all other racial ethnic groups. California's Black infants are almost 3 times more likely to die as white infants, regardless of the mother's education and income. Indeed, a Black woman with an advanced degree is more likely to lose her baby than a white woman with less than an 8th grade education. Research indicates that these perinatal outcomes are the result of toxic stress built up over a lifetime of experiencing racism, compounded by provider bias and racial disparities in healthcare quality and access. The profound impact of the overall context and life experiences on people's health is powerfully highlighted, of course, in the Surgeon General's recently released Roadmap for Resilience report. The report finds that adverse childhood experiences are strongly associated with some of the most common and serious health and social conditions facing our society, with the greatest impact on already disadvantaged individuals and communities. And we know these negative impacts are widely documented in adults. I think it's important to note that the Roadmap report also shows that publicly insured children in California exposed to 2 or more ACEs were 2.6 times as likely to have a chronic health condition as those with no ACEs. At the same time, a recent study by the California Office of the State Auditor reported that 2.4 million children in Medi-Cal miss out on important preventive care each year because of poor access to primary care providers and an inability of Medi-Cal managed care plans to meet the whole family needs. In 2019, only 26% of children in Medi-Cal managed care plans received their recommended well child visits in the first 15 months of life. In addition, we have one of the lowest developmental screening and early intervention rates in the country. While 18% of the state's children have a developmental delay or disability, only 3% of children receive early intervention by age 3. Screening rates are a key sticking point. Just 22% of children in Medi-Cal are screened for delays. Children of color and those living in low-income households are less likely to be screened than white children and those living in higher income households. And unfortunately, we know primary care has dropped off significantly during the pandemic, and pediatric care in particular has not yet returned to pre-pandemic levels. That means far fewer children are getting their necessary well child visits, screenings, and there's a backlog in children getting their scheduled vaccinations. So with that backdrop, I wanted to share some local examples of work that's happening on the ground in First Fives and with their partners in their communities to work on some of these issues. Excuse me. Starting with sharing some examples around work on Black infant health. First Five Fresno, we just heard from one of their commissioners, of course, as part of the public comment, is currently investing in work in the Fresno Grows Best Baby Zone project, which is a place-based initiative in a specific zip code that is addressing social, environmental, and economic determinants of health to ensure babies born in Southwest Fresno have a better chance in life. The First Five Fresno is supporting a Fresno-led Black Child Legacy campaign that's focusing on decreasing the top leading causes of deaths in African-American children. They are also collaborating with the UCSF Preterm Birth Initiative, California, and Fresno State Central Valley Health Policy Institute as part of a research study to compare prenatal care among 2 comparator groups to find which type of care reduces preterm births and infant mortality in Fresno County. Some other examples in this space are that First Five LA, in coalition with county health departments, providers, and the community, started the African American Infant and Maternal Mortality Initiative to address the high rates of Black infant and maternal deaths in LA. The steering committee for the initiative guides the implementation of a 5-year action plan to address these inequities. It also guides strategies to complement the plan and advance awareness and look at policy change. The initiative supports local community action teams that bring together community members and community organizations to address disparities in areas of the county with the highest rates of African American infant mortality. I shared with you at our in my comments at the last meeting in October, work that's happening in Sacramento, where home visiting is an important part of the work related to Black infant health. As you know, these efforts in Sacramento have been ongoing. The commission there, the First Five Commission, is providing funding for a collective impact model, which brings together various sectors of the community under the common goal of reducing Black child deaths by 10 to 20%. After these efforts on multiple fronts over years with many partners were implemented, the county did see a 57% reduction in Black infant sleep-related deaths and a 33% reduction in racial disparity on this metric. And the county saw an 85% reduction in Black child deaths due to child abuse and neglect homicide. In First Five Santa Clara, they are addressing Black infant health by consolidating their work in Roots Community Health Center, a primary care service provider that is focused on improving the health and well-being of Santa Clara's African American community. Roots uses a whole person care approach, connecting the dots between a person's physical health, nutrition, mental health, the environment, employment, housing, all as factors contributing to a person's well-being. And this holistic approach to healthcare is aiming to address Black infant mortality rates by getting at the literal root causes of health disparities, including the stress of racism, housing insecurity, and unemployment. Counties have clearly found many innovative approaches to work on the poor outcomes that we are seeing in this arena. and to gather those, learn from them, and help all counties make impactful change. The First 5 Center for Children's Policy, that is the think tank arm of the association, is launching a research and technical assistance project focused on Black infant health disparities in mid-February. Through this project, the consultant team will research best practices of community level work that improves birth outcomes for Black families, document innovations and achievements, identify and engage leading maternal and infant health focused organizations with whom to partner, and finally identify a cohort of counties to participate in a learning collaborative, identifying specific goals for change. And if it's of interest, I would welcome the opportunity to update you on the project over time as it advances. I also wanted to mention, again, I know we focused on this in my last report, but on home visiting. We know that there are very positive impacts that we see locally from home visiting on key health interventions. Evidence-based home visiting models have demonstrated a number of short and long-term outcomes gains for children and their parents, including improvements in overall parenting style, improvement in reported child behavior issues, and significant improvement in clinical levels of parent stress, anxiety, and depression. For example, First 5 LA has found that Medi-Cal enrollees in Welcome Baby, their home visiting program, have better outcomes as compared with the statewide managed care population on key performance targets related to maternal depression screening, postpartum visits, and childhood immunization. So we really can see that connection between a holistic program such as home visiting and health outcomes. And for these reasons, the state has made new investments in home visiting programs over the last couple of years. Thank you. We're very excited about continuing to work on those. And we believe there's still much unmet need for these services. The pandemic has interrupted home visiting enrollment and has led to lower rates of well child visits and referrals to developmental services. And we really see home visiting as an important tool to rebuilding families and communities as we move through the pandemic. With respect to mental health specifically, several counties support early childhood mental health consultation, a program that offers therapeutic support for children in child care settings, as well as to their parents and the teaching staff. So this is a space where I think there's some really important local work happening, connecting health and mental health with early learning. For example, the Early Childhood Mental Health Consultation Collaborative in First 5 Orange County is an initiative to address childhood mental health through early care and learning settings. By reaching children and families in ECE settings, Early Childhood Mental Health Collaboration promotes the earlier identification of potential mental health issues in young children, as well as more timely referrals and interventions. It also partners with the ECE providers in order to increase their capacity for supporting child mental health needs. More broadly, this approach supports provider training, parental education, on-site consultations, referrals to services, and clinical assessments and services. This initiative has shown the effectiveness of reaching children directly through their caregivers and in early childhood with early childhood educators, with an explicit focus on incorporating health promotion and health equity to support early identification and intervention in child mental health. Another key example related to that is dyadic care, and some really exciting work happening on this front at both the local and state level. Dyadic treatment is a form of therapy in which the infant or young child and caregiver are treated together in the context of a regular well child visit to the pediatrician or caregiver. A clinician is present with the caregiver child dyad or in a nearby room and coaches the caregiver to encourage positive interactions that can help improve parenting, the parent-child relationship, and the child's behavior. And both the caregiver and child have the chance to experience more positive ways to interact with each other. And there are several evidence-based models of dyadic treatment, including Healthy Steps, Dulce, and others, which First 5s across the state have helped to establish at the local level and to fund. And this evidence-based approach promotes developmental, social, emotional, and family well-being while preventing psychopathology from developing in children. And we know these models also improve immunization adherence and provision of clinical preventive care in the early years. Unfortunately, the health system traditionally has been challenged to find a way to encompass this holistic family-based approach. A pilot in San Francisco is experimenting with reimbursement for these services with the partnership of managed care plans. And recently at the state level, a really important development, Medi-Cal established a new benefit, the family therapy benefit, which covers family therapy for children without a mental health diagnosis, but at risk for later concerns. And this groundbreaking benefit provides an important platform and opportunity for ongoing efforts to ensure that expanded dyadic care is available to all children and families in Medi-Cal that would benefit from it. So it's a work in progress, and we think this is a really important area for continued work. And then lastly, in terms of a local example, I just want to touch on issues related to work in healthy development for our youngest children. As we all know, families in California have long reported difficulty and delay getting connected to appropriate supports when their children are identified with concerns. The service delivery landscape is very complex. In response, County First Fives have been investing in Help Me Grow over the last 15 years, leading the change to close developmental screening and service gaps and improve the functioning and early identification and intervention systems in the 30 counties where it operates. Help Me Grow operates call centers, provides screening, referral, care coordination, provides outreach and child development education to parents and providers. And also convenes partners so they can collaborate effectively to better meet the needs of families. And we see this, for example, in Sacramento, a Help Me Grow family advocate provides connections to services for at-risk families, especially those in transitional housing and shelters, and are actively participating in whole child, whole family efforts as part of that. In Alameda, Help Me Grow centralized access to point staff so that questions around food needs and the earned income tax credit and WIC and other family needs and referrals could be consolidated with the Help Me Grow coordination effort to really try to more holistically meet the needs of families. And in Yolo County, First Five is using their Help Me Grow data to inform their participation in a multi-county racial disparities steering committee to help the regional center find more equity in their service distribution. And their lead service provider has become a key community partner in addressing basic needs by helping to distribute lunches, diapers, wipes, books. Additionally, in recognition of how interconnected a child and parent's mental health are, Help Me Grow YOLO has invested in infant parent mental health trainings to ensure that there are enough providers to meet their community needs. So I think there's this holistic approach there and continued opportunity to connect programs like Help Me Grow to the larger health system as well, so that we can continue to work on scale and sustainability of those programs. So to close, we can see the power and the impact of this work on children and families, and that the next horizon involves continuing to build programs and approaches that center health and equity in a whole child, whole family framework, building on these efforts of integration, and in finding ways to scale and sustain the work so that these improved systems and system connectedness we are all working on to create are embedded in an integrated state-level system of interconnected child and family support spanning health, development, family strengthening, and early learning. Local First Fives see opportunities in our ongoing work in partnership with First Five California and with the broader landscape of state-level programs and initiatives to continue building a whole child, whole family approach that centers health and equity. We were very excited to see yesterday with the announcement of the ACEs Aware Network of Care Grants, the many First Fives that are leading and part of community collaborations to connect the health and social service systems by helping to build and strengthen robust networks of care to effectively respond to ACEs and toxic stress with community-based health and social supports that meet the needs of children, adults, and families. The primary, secondary, and tertiary prevention strategies highlighted in the Roadmap for Resilience report that are critical to improve health and life outcomes, particularly in the most underserved communities, address the key structural factors that we know are tightly aligned and essential to the work of the First Five mission and our core principles focusing on whole child, whole family, equity, systems coordination, and prevention. Also, as I mentioned earlier, we're very excited about the potential alignment developing around the new Medi-Cal family therapy benefit and the opportunity that groundbreaking benefit provides to hopefully increase the availability of dyadic care to children and families who would benefit from it. And on the home front of First Five's California's home visiting coordination grants, which Camille talked a little bit about, and related body of work at the state level, is really helping to lay a foundation to strengthen an approach that we know is deeply impactful for children and families and for improving health and family resiliency, particularly for families facing adversity. And we know that is especially important right now in this time in the pandemic and probably for years to come as part of the recovery. We appreciate First Five California's leadership on this issue in this coordination effort to strengthen our collective system of home visiting and the potential opportunity that that leadership provides to helping us build together approaches that can scale and sustain home visiting for children and families in California. So thank you so much for the opportunity to share some of this local work with you and how we see it connecting to the state work and our energy and excitement and rolled up sleeves approach to the partnership between those various opportunities and bodies of work. So thank you.
Thank you so much, Melissa. That was fantastic. And it's wonderful to hear about all of the excellent work that is happening at the county level, particularly with the focus on equity. And I will say, I personally am very pleased to hear that it sounds like the Roadmap for Resilience report is being read and put to good use. So that is fantastic. Any comments from commissioners?
I do. Melissa, thank you. It was really nice hearing your report and just the updates on everything that you guys are working on. You kind of asked a question, but not really, about, wanting to come update us on the Black infant mortality work that you all are doing. I say yes, we definitely want that. But really, I just want to thank you because I think you mentioned equity lens several times as you talked about many different bodies of work that you all are focused on and supporting. And that, as you know, with the commission is become really important to us in the last 2 years. I mean, it's been important to us, but I think what we have to challenge ourselves with as leadership is using that equity lens, not only to build new programs, but to revisit old programs and systems, because while again, we're all very focused, good people, a lot of systems were built on, on sort of racist perspectives, and not by anybody's intention, but lack of information, lack of inclusion of architects. And so I'm really excited that I'm hearing this word equity, but I'm also hearing the actual work and what we're doing to challenge ourselves. Again, not only about building programs, but about looking back and revisiting the infrastructure of systems that we have been working with for a long time. So Melissa, thank you for all your updates.
Thank you.
How about Elsa and then Chris?
If I may, Chair, I think Myra raised her hand before I did.
Okay, sorry, I was looking at there's two sets of hands. Why don't you go ahead, Maida, and then we'll.
Thank you, Elsa. Not necessary, but I appreciate you doing that. Melissa, thanks so much for that presentation. Wholeheartedly agree with Jackie's, with Commissioner Major's comments. Thank you for that. My only thing I want to do is to applaud the First Five Association and its network on really pushing the envelope on ensuring that our children have a right to grow up healthy and thrive. I think, those of us that are part of this commission and many of us that are watching this, we believe that it's a child's right to grow up healthy. And many of our programs for far too long have depended on discretionary funding in order to make sure our kids can grow up healthy. And you all have really been pushing it with our health plans, with our Department of Healthcare Services, to find ways that our mandatory funding streams like Medicaid can better support our children's upbringing from the earliest days. So I really appreciate the incredible leadership of the First Five Network and making this come alive, and look forward to working with you as we move that forward this year and in the future.
Go ahead, Elsa.
Thank you, Chair. Melissa, I'm very excited to hear about all of the work that's happening, and more importantly, how sectors outside of what we consider public health practitioners to be recognizing the critical and call to action that we have in terms of truly addressing social determinants of health in our children and families, and not just by traditional public health, healthcare sectors, but really by all the other entities and stakeholders that really touch our children's lives. I think you brought up a couple of excellent points with respect to revisiting how Medi-Cal is structured and what services are reimbursed. If we do want all of our children to access preventative care, then we need to extend it beyond just the physical health elements within a primary care setting. Many instances, federally qualified health centers and rural health centers are the trusted entity in our communities, particularly in more rural communities. And the more that we can ensure that they have the capacity, the infrastructure, and the appropriate funding levels to be able to meet our children and family needs under one roof, the better it is for them personally and for improving community wellness. And the second thing is really helping to surface all of the policies and structures that have been put in place, and calling out the fact that many of them have been designed by intention to continue to disenfranchise certain sectors and residents in our community, and really calling that out and helping to work together to be able to dismantle those structures that continue to further disenfranchise our communities of color, and continue to be pervasive in terms of the poor health outcomes that they're achieving, not only health, educational, but all of the other outcomes that really are a detriment to them being thriving individuals in our community. So I do look forward to additional reports and how we can bring that broader lens at this level, but also help influence changes through legislature and through funding mechanisms.
Thank you, Elsa. Go ahead, Commissioner Perry.
Welcome, Chair Burke-Harris and Commissioner Jimenez. It's such a joy to see you here today and joining this powerful group of women commissioners of First Five California. This is a very historic day on many levels, and you're joining the commission at this point is remarkable. I'd like to just underscore and bold a couple of key points Melissa made today. So appreciate the level of detail you're providing on the efforts statewide to address equity and the importance of integrated comprehensive health for children. I think this is a critical priority area for the state. And on behalf of the Secretary, I just want to relay strong support and interest and commitment to this kind of work. And as one of the commissioners on this team, I'd really like to offer my time and attention to this in whatever ways are helpful. We are already embarking on a couple of possible opportunities starting at the beginning of this year to deepen the work and the partnership within HHS departments and agencies on this topic. And hopefully we can collaborate very, very soon on how to invest in a more integrated, comprehensive set of benefits for children that are eligible for Medi-Cal that greatly improve their health outcomes and reduce disparities. So thank you for bringing all those examples. And now I look forward to the more integrated and strategic conversation about how we move to something more sustainable and scalable. Thank you.
Thank you, Commissioner Perry. And I don't see any more hands, but I just want to check if we have any more comments from commissioners before we move to public comment. I will add my own comments, which include the fact that in the Roadmap for Resilience report, one of the things that we really strongly emphasized was the importance of cross-sector collaboration. and the recognition that, which is exactly what we heard, that to improve the health, well-being, and development of children, we recognize that the partnership between our healthcare system and our multiple child serving systems is really crucially important. And we, First Five is such a powerful convener, partner, and activator of those partnerships to make that happen. And, specifically with California's ACEs Aware initiative, which, as many know, is a partnership between the Department of Healthcare Services and the Office of the Surgeon General. As you mentioned, we just announced yesterday almost $30 million of grants to support a network of care. And that was in recognition of the fact that as we support the rollout of ACE screening in California so that we can move to early detection and early intervention, right, which is what the science and the evidence is telling us is most effective, that we recognize that not all of those interventions happen in the doctor's office or in the exam room, and that it must be a partnership between our healthcare systems and the multiple systems that are serving both children and their parents and caregivers. And so we're really pleased about this this integration, as we heard from Commissioner Perry, and just looking forward to more opportunities to do more of that. So thank you. And with that, I'll open it up to public comment.
No public comment at this time.
Wonderful. Do you have any final words, Melissa, to respond to any of the comments that you heard?
One thing I failed to mention I should have, and maybe Camille, you might want to share some thoughts on this too. The First Five Network, including First Five California, the First Five Association, and the 58 local First Fives, are embarking on a 2-year race, equity, diversity, inclusion initiative together. That is a learning and action framework at the individual, organizational, and policy and systems level body of work. We are just starting it, like literally I have a meeting with the consultant this afternoon to sort of really fully launch our next step. But we are going to be forming a core team from representatives across the First Five Network, including First Five California and the association, that will be co-designing and shaping this work over the next couple of years. But I think, to Commissioner Major's point, it is in part intended to do that kind of work, that really deeply reflective work, and to equip us to do that in a truly meaningful way as individuals, as organizations, and in the systems and policy contexts that we all work. So we are really ready to dig in more deeply to that work through that initiative, and look forward to doing that in partnership with First Five California leadership and staff as well. And then lastly, just to say how excited I am about the alignment and the partnership and the opportunity, and how ready we are to go to work to continue advancing all of the issues that we've raised in this discussion today. So with a lot of gratitude, thank you.
Thank you. And now commissioners will have an opportunity to report on their respective advisory committee meetings. At this time, does any commissioner want to report on an advisory committee meeting in which they participated? And commissioners may defer comments until the relevant agenda items are presented. Okay, hearing none. We'll move forward with public comment. Members of the public may speak for up to 3 minutes on any non-agenda item or items not related to pending judicial, administrative, litigation, or personnel matters. No action by the State Commission may be taken on this public comment. If you wish to comment, please use the raise hand function or the chat function if that's not available. And Jamie will call on the public in order in which they signed up.
At this time, we don't have anyone signed up for public comment. I would ask, though, I've had someone who asked if Commissioner Jimenez might give us a couple of minutes on her background as well. We so enjoyed getting to know you. So Dr. Burke-Harris, if you wouldn't mind, we'll give her an opportunity to say a few things as well.
Wonderful. Commissioner Jimenez.
Sure. Thank you very much for that. So I'm from Monterey County, born and raised, and had the opportunity to go away to pursue higher ed and come back to my community to serve as a public servant. I am a daughter of immigrant parents from Mexico who worked their whole careers in agriculture, both in produce as well as cattle. King City has, believe it or not, a few remaining cattle ranches. So as you can imagine, being the first in my family to attend college, I set the path for many others to follow, my siblings and now my nieces and nephews to pursue higher education as well. As was stated, I've been with the County of Monterey for almost 20 years and have had a tremendous career growth in terms of being able to recognize the importance that we as public health practitioners have and shifting the blame away from individuals and really looking at the systems that we reside in that help to shape the communities that we live in, and really helping to lead with the health and all policies lens to dismantle those systems, modify those policies so that truly every resident has an opportunity to be able to achieve their fullest potential regardless where they live in a community. As a mother of 2 young girls, sadly, they're already out of the 0 to 5, they're 12 and 8. I definitely recognize the importance of investing early. For every dollar that we invest in prevention, we save about $14 or so in terms of longer term expenses. And we do recognize the need to really move upstream. And as I mentioned, lead with a health and all policies lens, whether we're looking at how we're designing communities, whether we're looking at what programs we need to put in place, and more importantly, looking at priorities for funding in that early care space. In my role, I see how many of our children did not have the right environment or the right opportunities when they were growing up. And so it's easy to see how somebody may have lost their path and then become conserved, for example, or then have started to use and abuse drugs, again, because of the fact that they experienced so much trauma early on and it was not addressed in an appropriate and timely fashion that they now are unfortunately impacted. And again, if we would have invested early on, many more of our residents would be living and thriving in our communities. I'm a committed public servant. I serve on many boards. I'm a local commissioner for a local managed care plan. I'm the chair of our Children's Council. I recently joined our Community College Foundation Board. I'm a member of our Community Foundation of Monterey County. And so I really have a broader lens in terms of helping to insert myself in spaces that I could hopefully help to influence and really have different sectors recognize that it's not in the individuals that we need to correct, it's really the systems that need to be adjusted so that more members, particularly our communities of color or Black, Indigenous people of color, really have the same opportunities and receive further investment than others because we know that we have not invested in communities that are where our BIPOC people reside in. And so I'm excited to be able to take what I've learned and what I've helped to build here locally in Monterey County and be able to help shape statewide policy. So I'm excited to work with all of you. And as Commissioner Perry said, it's very exciting to see such a diverse set of women helping to take charge in the 0 to 5 space. Definitely not something that I'm accustomed to. Usually I'm the lone female and sometimes the lone woman of color. So more power to us.
Thank you so much. Yes, it is a beautiful thing to see. And now we'll move forward to the consent calendar. Items under consideration. Items on the, oh, sorry, go ahead.
Dr. Burke Harris, we actually do now have a public comment.
Oh,
so we can finish that.
Karen Potts.
Karen Potts?
Thank you. Hi, the commissioners that are part of the First Five California team know me and welcome. I just wanted to take a few moments to welcome you, Dr. Nadine Burke Harris, as well as Commissioner Jimenez. As the First Five Executive Director for for Siskiyou County, it is such an honor to continue to work with all of you. And I also wanted to take this moment to share our appreciation for the amazing team at First Five California under the leadership of Camille Mabin. You will, if you haven't already, you will quickly know the cooperative, creative, thoughtful leadership of Camille that has set the stage in the work of First Five California with all counties, including the most rural of us. As some of you know, First Five Siskiyou is home to a county that's 5,000 square miles and with only 2,500 0 to 5-year-olds. So all of your commitment to our rural communities, as well as the leadership of and support of Camille and the team at First Five California is much appreciated. We welcome you and we look forward to you visiting us in beautiful Mount Shasta.
Thank you very much. Camille, do we have any other public comment?
Nope, that's it.
Wonderful, thank you. So now we'll go ahead and move forward to the consent calendar. Items on the consent calendar are to be considered routine and will be enacted by one motion followed by a vote. There will be no separate discussion of these items unless the commission, audience, or staff request specific items be removed from the consent calendar for separate discussion and action. Any agenda item removed will be voted upon following the motion to approve the consent calendar. Does a commissioner or a member of the public wish to pull an item?
As stated earlier, I think it was asked that we pull 3C from the consent calendar as one of the commissioners has a conflict of interest.
Okay, wonderful. So we will pull item 3C. And any other items? In that case, can we call for a motion to approve the consent calendar?
I move to.
Second.
Oh, great. So Commissioner Hazen has moved, Commissioner Majors has seconded, and Jamie will do roll call.
Myra Alvarez,
Aye.
Nadine Burke Harris,
Aye.
Monica Fitzgerald,
Aye.
Shayna Hazen,
Aye.
Jackie Majors,
Aye.
and Molly Munger.
The motion is passed.
She's
Sorry, I'm sorry.
we just need to ask for Elsa's vote.
Sorry.
Yeah.
Elsa
Oh.
Jimenez.
Aye.
Okay, that's it.
Thank you. The motion is passed.
Right.
And now do we want to move forward with a separate vote on item 3C?
Yes.
Ready?
Call for a motion?
She needs it. She needs a motion.
And we need a motion, Dan.
So moved. Or I'll second Molly or
Molly.
Commissioner Munger.
So motion by Commissioner Munger, seconded by Commissioner Alvarez. Jamie, if you could do the roll call.
Myra Alvarez,
Aye.
Nadine Burke Harris,
Aye.
Monica Fitzgerald,
Aye.
Shayna Hazen,
Aye.
Jackie Majors,
Aye.
Molly Munger.
Motion carried.
Okay, great. Do we need to call for Commissioner Jimenez and just have her abstain on the record?
That's probably best. Yes.
Elsa Jimenez,
Abstain.
Wonderful. Thank you. And now we'll move to the regular agenda. Protocol for action items includes staff presentations, questions from the State Commission, public comment, deliberation, and voting by the State Commission. There will be a 3-minute per person time limit during the public comment. The next item, which is typically done on an annual basis, is a request for the commission to elect a vice chair and approve assignments to the commission's standing advisory committees. Camille will now provide some history and lead us through the vice chair and advisory committee selection process.
Thank you. So as Chair Burke Harris just said, every January, the commission elects a vice chair and has a discussion and list and we fill our advisory committees. So we'd like to begin, obviously, with electing the vice chair. In accordance with our First 5 California bylaws, the vice chair will be elected by the voting members of the commission. Whomever is elected shall serve in this office for 1 year, beginning at the adjournment of the meeting for which they are elected. The role of the vice chair is to fulfill the role of the chair in their absence at meetings. And with that, we'll turn it back over to Dr. Burke Harris to facilitate the actual nomination and voting of a vice chair.
Wonderful. So do we have a nomination for vice chair? Go ahead, Commissioner Majors.
I would like to nominate Commissioner Munger to continue in the role of vice chair.
Second.
I second.
Okay, so Jamie, do you want to call the roll?
Okay. Myra Alvarez,
Aye.
Nadine Burke Harris,
Aye.
Monica Fitzgerald,
Aye.
Shayna Hazen,
Aye.
Jackie Majors,
Aye.
Elsa Jimenez,
Aye.
Molly Munger.
On that, but I very much appreciate continuing as vice chairs. Thank you very much, everybody. I'll try to do a good job. And I'm very happy to have a new chair to work with. It's fun. It's fun and exciting.
Well, wonderful. The motion is carried and I look forward to working closely with you. Thank you for your service, Molly. And now we'll discuss the advisory committee assignments. Camille, do you want to guide us through?
Sure. Again, it's the commission's usual business practice to review the committee assignments each January and to revise them as necessary. Additionally, when vacancies occur, which happens now because we have 2 new commissioners, we have vacancies on some of the committees. The commission will take an action as necessary to fill the vacancies and during any regular commission meeting. So with that said, the current advisory committees are listed in your materials, so you can see the list of current and vacant places on the advisory committees. Generally speaking, there have been 2 members on each committee, and having 2 members on a committee allows commissioners and First 5 California staff to work into related topics if the commissioner chooses to do so. We also last year, if you'll recall, had one of our advisory committees have more than 2 members, which totally allowable if the commission wishes to do that. On the side, pro side, it allows more commissioners to serve on a committee they may be interested in. The other side of that coin, or the challenge, is that when we get more than 2 members, they do become a public meeting, which means the agendas have to be 10 days in advance and posted and for public notice. The other part of that is the committee discussions may become more limited as the scope is narrowed. For example, if on a standing advisory committee, if there were 2 members or less, and they wanted to look at a scope of work for an RFP, that wouldn't be an issue. If a committee had more than 2, then having the committee members look at it would then make it a public document, which would be a problem for potential bidders. So it's not impossible. Certainly we proved that this last year, but that's just making you aware of that. If you'd like, Dr. Burke-Harris, I'm happy to kind of go through each of the committees and see who might be interested in either staying on that committee or finding a new committee, or I don't know if you want to have any discussion with commissioners before we fill out that list. There may be, commissioners may have an interest in how we go forward, certainly. But if not, I'm happy to kind of keep track of who wants to go on which committee. And then in the end, if you can call for a vote to approve.
Wonderful. So I think that sounds great. Looking at the standing committees, I don't know how we want to go, whether we want to go committee by committee and see, who is interested in participating on which committees. Does that sound like a thoughtful way to proceed?
Yes, I see hands shaking. Great.
All right. So should we start with the public education and outreach?
I think Shana raised her hand. So I think Shana has a comment.
Yeah, just a clarifying question, I guess for Camille. So earlier when you discussed the development of this new data digest, was that being done in partnership with the Strategic Planning Committee?
There will be, yes.
Yeah.
Yes.
That's not being done by the research and evaluation.
It started with we started talking with the Strategic Plan Advisory Committee because really what came out of it, what came out of some of the comments that commissioners had made in the past, it kind of fell into the strategic plan, and that's where it landed initially.
You know what, Camille, because we do have new commissioners at this meeting, do you mind doing a brief summary of the work of each committee? So that way folks are making an informed choice as they make their.
Yeah. Certainly. So hold on here. Okay.
Can I add?
Sure. Go ahead, Shane.
Just one additional request, which is sort of the key projects for this year. So as we look ahead.
I'm sorry, Shana.
Oh, I said, and if you could highlight the key projects you anticipate each committee working on this year.
Sure. So the first one is probably the easy one. So that's the executive committee. That's usually the chair and the vice chair. And what they do is work with us on meeting agendas and provide guidance on significant administrative issues and staff activities. That's kind of a set one. So I think we can move on. We have a vice chair, we have a chair. So with that, the Public Education and Outreach Committee, this last year had 4 commissioners who participated on that. And the work of that advisory committee is really to provide guidance to staff regarding effective communication and strategies for hard to reach and low income parents and families of young children. Certainly we have an RFA that is getting ready to go out in April for our next communications contractor. Those are the folks that have worked with us in the past on developing campaigns like Talk, Read, Sing. Additionally, that contract will encompass our public relations contractor, current contractor as well. We're melding those two. I see the committee as having, as we look to work with where our next campaigns go, they would have, this committee would be working with staff on the future of those campaigns. So I think that's where that would land. I think that's the big piece of work for this year. So at this point, do you want to stop there and see if, do you want me to go through them all, or do you want me to?
All of them, yes.
Oh, okay,
exactly.
okay. The legislative, the LAC, the Legislative Standing Advisory Committee, provides guidance on legislation and budget items within the commission's subject matter jurisdiction, including the statutory purposes of Prop 10 policy and programs affecting early childhood education and care. They are the standing committee that work with external and governmental affairs on giving guidance and advising us on possible positions to take on bills, on legislation, recommendations on other policies that may come out at both the federal and state level. This year, as you will hear from Alex, we're getting ready to review an RFP for a federal lobbyist, so the committee will be involved in that. They advise us on things like the policy agenda, which children's are our policy agenda, which you will hear a little bit more about in today's presentation. They are active, ongoing committee. I will just say in the world of meetings, it depends on where we are with legislation that or needing advice. Sometimes it's a once meeting between commission meetings, and sometimes it's 2 or 3 depending on what's going on at the Capitol. But that is the legislative committee. Research and evaluation provides guidance on our agenda, our research and evaluation agenda. And certainly one of the annual things that we bring to them are the guiding principles and guidance for implementing the Children and Families Act, including studies on early education, workforce, preschool, early literacy, and parent interventions. It really is, I think, for those who are on that committee, it is an opportunity to really think about not only the work that the evaluation work that we do within our own investments and what that looks like, but what outside the investment should we be looking at to as far as research and evaluation. So for instance, in that committee right now, the dual language learner pilot study is there. That there will continue to be work around that, home visiting, I would, and then the conversations, I think, have been rich with our current committee about what it is we should do or what it is we should be looking at. So that is that committee. Our program committee reviews and provides guidance on obviously our program agenda, which includes development and implementation of programs designed for children, parents, early learning workforce. So things like impact and our continuation of our work with Impact and Quality Counts California resides in the program committee. You'll see the small county augmentation came before the program committee this time. Smoking cessation came before them and is ongoing. So really looking at, as we work on impact and how that affects and our work with Quality Counts California going forward. I think the implementation of the master plan, several of the projects are as in shared services or will be located in that program committee purview. Other ways we might be working to implement and align with other state agencies going forward on the health side, and it results in a program investment will come before that committee. And I do foresee in the future, this coming year, as more and more rolls out about the exact work of not only the master plan, but thinking about, as you heard from Melissa, whole child, whole families, and how that work goes. It could reside, most likely will reside in the program committee. Our fiscal committee reviews and provides guidance on the fiscal management of First Five California. We have our current advisory committee on fiscal has been strong on helping us figure out how best to display our financial data in a way that is clear and concise, not only to commissioners, but is transparent to the public as well. I think we will continue to hone in and refine that work, and I see that as part of the work of that fiscal committee going forward. The last one is the strategic planning committee. Clearly, we have an adopted strategic plan, but as we go forward, as we said, the data digest was really part of the work of figuring out in the implementation of the strategic plan, how do we best obtain the information to really see if the plan is working. And one of the big things this year, towards the end of the year, I think we're about a year, will be honing in on a kind of a midway point of our strategic plan to say, we'll probably do, as we have in the past, a day retreat to go over the strategic plan to see if there's any places where it needs to be tweaked, if there are any places where we need to say things have changed and we need to make some amendments to that plan. So I foresee that work will land in working with that committee. So those are our current standing committees. We so appreciate all the work that you all put into those, and hopefully you see your good work reflected in what's presented at commission meetings as well. So with that, do you want me to go back to who would like to maybe take a stab at being on what committee? Would that work?
Yeah, before we go there, do any commissioners have any questions about any of the committees? I had just one question about the program committee. In terms of the program agenda, it's really around, is that really around kind of implementation of application of our dollars? Is that really around putting our dollars towards programmatic, towards programs with the goal of, you know, implementing our strategic plan? That's essentially it.
Yes.
Okay, that's really helpful.
I have one question about the strategic plan committee. Do we have milestones that we're meeting for the strategic plan or implementation of it? And if so, can we have like quarterly updates on that? Or what is our adherence to the strategic plan, and is, yes, can we have quarterly updates on that, or can we see what the milestones are?
We can certainly have quarterly updates on where we are with that. I think part, Myra, of the data digest work is to make more clear the milestones and the outcomes we're looking for, and if in fact we are meeting those data points. But we're happy to bring quarterly reports to you about where we are with that.
Go ahead, Commissioner Perry.
Thanks. Camille, can you help also explain how you support the committees with staff? I know the number of total staff for the commission has fluctuated some. You've announced some new hires today. I think you have 60 or so in staff, and some have they specialize in different parts of the early childhood system. So I think it would also be interesting to understand, you know, how you know, getting back to the question about how many should be on each one and what that entails for you and your team, and sort of what's involved in the staffing of any of these committees, so we, you know, can better understand what it means to go from 2 to a bigger number or not.
Got it. So right now we are at maybe 40 people. So we are about 40, which is including the people we just hired. So with each committee, there are some dedicated staff members. So I'm going to use the legislative committee, for example, Alex DiCaprio, or in the sense now Max, will come in and they literally staff the committee, work with the advisory committees, but creating agendas. So each committee generally has, I would say, one staff member responsible for working, scheduling meetings, making the agenda, doing that. As the meeting comes with the advisory committee, more staff who maybe have a specific project that is coming before. So I'll use an example. In the program committee, generally Erin Doobie makes up that schedule, but at our last program advisory committee, it was Debbie Silverman who had the presentations because she had SPCFA. And so while one staff member may be responsible for staffing the advisory committee, we bring other staff into those meetings as needed. That's kind of how we do it. But there's generally not more than one person. Does that make sense, Chris? Does that answer your question?
It makes sense. And then just back to your point, I way overestimated the total staffing at First Five California. So just following up on that point, is that because you have vacancies, or because you've been reducing the total number of positions?
So when I arrived, I think we were at about 40, I want to say 45, 46 maybe. But never hit the 50 mark, at least while I've been here. And so we did have a reduction of retirements and some people moving, and looking and trying to figure out with our administrative account and funding over time kind of tightened. our belt a bit. But having seen where some of the vacancies lie, for instance, the Deputy Director for External Affairs, we searched for a while to find Max. It wasn't a first time out. So it's taken us a while to go back and fill in some of those vacancies. We still have a couple that we're looking to fill, and including a chief deputy, which we're in the process of looking for. And we are getting ready, hopefully, knock on wood, to interview some people. I don't ever see us getting too much above, 45 at the most. Yeah, at the very outside, 50 people. I mean, that, yeah. Shana?
Oh, and not to belabor the point too much, but I'm wondering if you could just add to the personnel report we get, just any vacancies. So then we just have that snapshot every quarter.
Sure.
Thank you.
And we'll go to Commissioner Majors, and then I think we need to, just looking at the time, we want to move forward with selecting advisory committees.
Great, I appreciate that. My question was about process. So as we move forward in this process, is everything up for grabs? Are we acknowledging the current commissioners that are sitting on advisory committees? And are we highlighting where we have vacancies that were created by the commissioners who have termed off? Just a question about process.
I think that is, some of those questions will be answered by all of you. There are, in your list, you see where there are vacancies. It will say vacant. There's where a member has left. So you see those vacancies. In the past, Jackie, I'll just say it's gone both ways. People have said, commissions have said, who wants to continue to stay? And people would raise their hand. Or the other is, who wants to, let's start from scratch, and who would like to maybe get off a committee, move on to another committee, or, but it's generally been a consensus of the commissioners how they would like to go forward with that part of it. With the, do you want to start from scratch, or do you want to first ask those people currently serving on those committees if they would like to stay? I don't see nodding in either direction. So would people like me to ask, first of all, to those commissioners who are currently on a committee if they would like to stay on that committee? Thumbs up or no? Yes, yes, no? Myra's.
Well, I just think that puts a lot more pressure on the commissioners to make the active decision to leave a committee versus the decision as a whole. Do we want to make our committees bigger? Right? So I have no problem staying on research and evaluation, but I'm very interested in program and I'm very interested in public education. That means public education is already bigger. That means program has to get bigger. So it's a more of an active decision for the commission to get bigger versus me leaving.
So I think that is maybe a discussion that you all want to have around, do you want these committees to expand? Again, and Chris kind of said, I think, in asking about how much staff do you have to, what's the bandwidth? If, and I will say that as committees go to public meetings, it is like for us another commission meeting. I mean, we're having to, we're having to post, we're having to post items, we're having to send out. So it is a workload issue. There's no doubt about it. I'll just be upfront.
Go ahead, Commissioner Majors, and then I think we should just go through and just move forward with deciding how we want to.
Yeah, I agree. I just wanted to make this one point because I feel like this all changed my first day as a commissioner. Things had been one way forever. And then when I came on and was elected to public outreach, the dam broke. And and we changed at that point based on the understanding and the collective understanding that we all felt that public outreach was where we were investing a significant amount of our money, and sort of a broader participation was warranted. I would just caution us to not do that with every committee, because good functioning governance really does require committee members to bring things to vet, to go deeper, and to bring things back to the full board. So I would just throw this out to say that if we wanted committee members to have a more involved role in reporting out, I think that's one option that we can consider. But I would really challenge us not to make every meeting a lot of board members, not only for the capacity issue with, with Camille and her staff, but I just think with good governance. So that's my 2 cents.
So go ahead, Commissioner Munger, and then Commissioner Hazen, and then go ahead.
I agree with Commissioner Majors totally about this, and would just like to say that as I am in my last year on the commission and vice chair, so I have a berth already, the only committee that I have any sense that I should stay on, although I'm on some of the ones that are very interesting, is the fiscal one, which is the one where we've been working on the presentation of financial information, and it's complicated, and I just as soon stay with that one because it's kind of in mid-flight. But just in case it reduces the pressure to expand committees, I'm happy not to be on either strategic planning or program, which may clear space for others on those committees. And then I'll just serve in any place where there's a gap. Perfectly happy to do that.
Commissioner Hazen.
Yeah, and I wanted to share sort of along the same lines. I'm comfortable stepping off of public education and outreach if we want to make that a smaller 2-person committee, and also fiscal. And then a question, Camille, as we think about workload and capacity, does it make sense? I'm just thinking that there seems to be, and I could be wrong, overlap between research and evaluation and program. Does it make sense at all to consolidate that into one committee?
Commissioner
We can.
I think so.
Yeah. we can do that. There is some overlap. Clearly, I think the conversations, I think there is work in research and eval where I see it certainly could happen. The funding is different, we kind of went by part of it.
If it doesn't make sense, I just wanted to throw that out there, just being mindful of the limited staff we have and of capacity. So in the same way we might reduce to 2 committee members, doesn't make sense at all to consolidate a number of committees.
Yeah.
So to you.
Okay. I think one of the values of the research and evaluation is really the conversations about what is it that we can do, that as our research and development agenda goes forward, and that doesn't mean those conversations couldn't happen in a committee that is together. Do you know what I mean? But I really appreciate the conversations that go on in that committee around what's possible or what we could consider going forward as part of research and evaluation. Chris, do you have your hand up?
I do. I'm looking at the table in the handout, and I think, this is a reflection of how statute divides the funds into accounts. And for the most part, that's what it reflects. And one of the challenges of carrying that paradigm into what is now our 3rd decade is that we're assuming that every decision we make will be exactly aligned with the way statute described our work 22 years ago. And I challenge us, because I really appreciate what Commissioner Alvarez is saying here about before defaulting to the way we've been doing it, stepping back and thinking about what we heard from you, Camille, and from Melissa this morning about all the experimentation that's going on and the evaluation and the scaling and opportunity seeking that's happening, as well as what's happening on master plan and roadmap to resilience, what may happen with federal recovery funds. There are just endless numbers of opportunities for greater and greater strategy and integration. And when I look at the names of the committees, they don't even really inspire the kind of creativity and innovation that they could if we got away from how we've talked about the work as related to statute versus the work we really want to do, the work we really want to be accountable for. So even calling something fiscal, it should be called investment or growth or something like that, or sustainability. The strategic planning group, that's a great, in my mind, that's a great development. But then I look at program and it doesn't say that doesn't really say anything. You've had to explain it over and over again because that word isn't really adequate for everything that goes on. So I know how important it is to get these things settled, because you got to get a lot of work done, and going back to the drawing board does not facilitate that happening. But I do also just feel like we have this amazing group and we have all this new expertise and energy on the commission, coupled with all of the insight and expertise of the commissioners staff who were here before. And I just feel like we should be reimagining the committee work and what it's really for and who it's really supporting before necessarily everybody volunteering. So I just kind of want to make a pitch for something a little more forward thinking, maybe, than looking back at the statute. And I can stop and I'm fine if everybody says, please don't make us do that. But I also think it's really, it's not even legislative. That should that be, now that we're talking with advocates in Washington, shouldn't that also say advocacy? And just, there's just so much opportunity here to rebrand who we are and how we're going to work together.
What I would ask, because I think you're absolutely right, Commissioner Perry, and at the same time, I think that degree of work is something that we're probably not going to accomplish during this meeting, right? I think it takes a little bit of a dive. And I wonder if that work would not be the work of the Strategic Planning Committee, really in terms of doing a deep dive and reimagining how we are executing against our strategic plan and whether or not the structure of our committees are in line to be able to do that. So what I would ask is that we perhaps put that as one of the tasks of our Strategic Planning Committee, and perhaps at this time move forward with signing up for the committees as they stand right now, with the understanding that going forward we have the opportunity to do that reimagining, and that is exactly what we want to do in this year.
I think I see people kind of nodding yes on that.
Okay, great. So with that in mind, do we want to move forward? I will go ahead and just go down the list. The Public Education and Outreach Committee is the one where we currently have 3 commissioners, Commissioner Major, Commissioner Hazen, and Commissioner Perry. And I think perhaps it makes sense to ask what additional interest there may be in this commission, in this committee. I will go ahead, Commissioner Alvarez. Yes, and I will say this is an area of strong interest for me as well, so I will throw myself into the mix there. So we now have 5 who have interest. Is there anyone who has an interest in stepping off, Commissioner?
Yeah,
Hazen?
I had mentioned before, I'm happy to step off if we want to get back down to 2.
Okay. And I think.
Chair,
Mhm.
Chair, may I ask for clarity? So is public education and outreach now comprised of 4 members? The 2 from last year and then the 2 new ones?
Well,
Or is
so,
it the 2 new ones?
so right now where we are is that we have interest. So there are 2 members who are currently on the committee. There's additional interest from 2 additional members.
I think they're trying.
And I think that to speak to Commissioner, and it sounds like the 2 members who are currently on the committee have a strong interest in staying on the committee. Is that correct? Great. So what that means, I would say then for Commissioner Hazen, if you are trying to giving up your spot to bring that number down, it's up. Looks like we're not going to get down to 2. So so I think it's up to you in terms of.
Then I'd like to stay on if.
You'd like to stay on. Okay. So where we are currently is that we have Public Education and Outreach Committee, which is comprised of 5 members. Okay, so we will document that and move forward to the Legislative Committee. Currently, it's Commissioner Hazen, and the other seat is vacant. Are there any commissioners who are interested in joining the Legislative Committee?
Commissioner Jimenez, I'd gladly join the Legislative Committee.
Thank you for your service. Any additional interest? Hearing none, we now have 2 members interested in the Legislative Committee. Next, the Research and Evaluation Committee, currently comprised of Commissioner Fitzgerald and Commissioner Alvarez. Is there any additional interest in serving on the Research and Evaluation Committee? Okay. Hearing none, we can, is anyone who is on the Research and Evaluation Committee eager to give up their spot or looking to step off of that committee? Okay, hearing none. Moving on to the Program Committee, currently comprised of Commissioner Munger and Commissioner Majors. We heard from Commissioner Munger that she is happy to give up her spot on that committee, yielding 1 vacancy. Anyone interested? Commissioner Alvarez? Anyone else interested in the Program Committee? Commissioner Perry?
I am, but I'm very sensitive to the issue of 2 versus 3. So I'm just going to raise my hand, but I will defer to Commissioners Alvarez and Major if that's ultimately the best thing. But if there are others beside me and it's going to go above 2, I would like to join.
Thank you, Commissioner Perry. So we have 2.5 in the Program Committee. Moving forward to the Fiscal Committee, we currently have Commissioner Munger and Commissioner Hazen. Commissioner Hazen has again volunteered to vacate her seat. Is there anyone who has a strong interest in the Fiscal Committee?
Maybe you're not going to get away, Shayna.
Fiscal and Finance going once. Okay. All right. Commissioner Hazen, are you happy to keep your seat if you are, if there's
Well,
no
so
one else?
I'm interested in strategic planning. So if I could go over to strategic planning and leave fiscal, that would be my preference.
We have a potential vacancy in fiscal. Why don't we go, so we have a vacancy. We have Commissioner Munger is currently the one commissioner on the committee for fiscal planning. And for strategic planning, currently we have 2 seats vacant as Commissioner Munger has graciously agreed to vacate her seat. All those interested in strategic planning, I will say I am interested in strategic planning. Commissioner Hazen is interested in strategic planning. Anyone else interested in Commissioner Jimenez interested in strategic planning?
Yeah.
Okay, so we have 3 interested in strategic planning. So we currently, if I have this accurately, we have the Public Education and Outreach Committee is at 5. Ledge is at 2. Research and Evaluation is at 2. Program is at 2.5. Fiscal is at 1, and strategic planning is at 3.
Chris,
May I make a friendly amendment?
Yes.
I will happily switch my interest to fiscal and not complicate the program committee question, if that's.
Okay. Thank you, Commissioner Perry. And that leaves us with 3 in strategic planning. And I think we're not close to 2 with public education and outreach, so I will let that go. I think that in terms of strategic planning, is there any, Commissioner Jimenez?
Yes, thank you. I am being mindful of staff's time, and I know what it takes when you have more than 2 members on a committee. But I also am trying to be mindful of the fact that I should be on 2 different committees. So, I mean, I'm happy to step off strategic planning to help alleviate some of the workload for the staff, but then I'd only be on 1 committee, which then I feel like I'm not contributing as much as I should to the commission. So I guess I'm asking you for direction on that.
Okay, so you know what we'll do? That's a great point, because I, as chair, am on the executive committee, although I have a strong interest in the strategic planning committee. I will step off of the strategic planning committee, and I will, and that can balance things out, I think, a little bit. All right, so we've had a very gracious balancing of the committees. I think where we are, just as a quick recap, executive committee is a chair and vice chair. Public education and outreach, Commissioner Majors, Commissioner Hazen, Commissioner Perry, Commissioner Burke Harris, Commissioner Alvarez. Ledge, Commissioner Hazen and Commissioner Jimenez. Research and Evaluation, Commissioner Fitzgerald and Commissioner Alvarez. Program, Commissioner Alvarez and Commissioner Majors. Fiscal, Commissioner Munger and Commissioner Perry. And Strategic Planning, Commissioner Jimenez and Commissioner Hazen. Do we have a motion to adopt the committees as I just read to you?
So moved.
Second.
Jamie, if you could please do the roll call.
Yes. Myra Alvarez,
Aye.
Nadine Burke Harris,
Aye.
Monica Fitzgerald,
Aye.
Shayna Hazen,
Aye.
Jackie Majors,
Aye.
Elsa Jimenez,
Aye.
and Molly Munger.
Aye.
Thank you. Motion carries.
That's it. Motion carries. Yay. I knew this would be one of the things we'd talk about the most this morning. So good for you. So, oh, good. Thank you.
Wonderful.
All right.
Thanks, everyone. And now just checking in on the agenda. We're a bit behind schedule. The time is 12:21. We were anticipating having the annual report from 12 to 12:15. If folks are interested, perhaps, and then the next item would be a lunch break from 12:15 to 12:45. Do individuals prefer to break now for lunch and do the annual report after? So I see a lot of heads nodding. So if it's okay with folks, I'll recommend that instead of 30 minutes for lunch, we take 20 minutes to split the difference. We can reconvene at 12:42, and at that point, we can actually, let's reconvene at 12:40. I know it's a long day for folks, but it will take 18 minutes for lunch, and then we will return at 12:40 and resume with the annual report.
Thank you very much. We'll see you then.
Okay, thank you. All right, it looks like we are at 12:40 on the nose. So I'll ask commissioners to turn their cameras back on, and we will resume the meeting. And let me just make sure that we have quorum here. Okie dokie. It looks like we have a quorum. And so we will resume with the presentation of the annual report. The annual report, as it states, is presented annually to commissioners for approval. As required, the report will be submitted to the governor, the legislature, and the county commissions. I'd like to welcome David Dodds to present the annual report.
Is David there?
Is he in there?
I think.
I know, but is he there?
Oh, looks like David is, I just saw his name.
There he
Trying
is.
to fin out, yeah, thank you. Had to figure out the Zoom panel which in there. So good afternoon, commissioners. I'm David Dodds, the Deputy Director of the Evaluation Office. I would also like to welcome our new chair, Dr. Burke Harris and Commissioner Jimenez. I know we all look forward to working with you. I have the pleasure of bringing to you for your consideration and approval the annual report for fiscal year 2019-20. So what I'd like to do is give you some background on the annual reporting process and what is required, and then also to talk a little bit about some patterns we saw in the data this particular year. So as background, the annual report is required by statute in the California Children and Families Act. As our chair already mentioned, the final report is then distributed to the governor, the legislature, and county commissions. The organization of the report covers the history of First Five California, the role that the state controller plays in audits, the support that the county commissions provide to children, parents, and health and child care providers. Also at the end of the report are county commission highlights, where each county commission describes its work, and then appendices that contain some of the fiscal and client data. So a little bit about the process. So fiscal data are submitted by county commissions via our annual report data system, and the data are based on audited statements from each county commission. The data collection format is established in the annual report guidelines that are brought to commissioners each year prior to the fiscal year, typically in April, prior to the fiscal year. So one of the things that as I was working on the data with staff is we noticed that there were some differences in the data possibly related to the pandemic. And so I wanted to show those to you. So, so the question I'd like to explore is comparing fiscal year 2019-20, when the pandemic started, with the prior fiscal year 2018-19. Did the pandemic possibly impact the county commission reporting as visible by expenditures and clients served? These data are contained in Appendix A of the annual report if you would like to look at the data in more detail. And next slide. So this slide shows the expenditures reported by what are called results areas. So the result areas have been established in collaboration with the First Five Association, and they cover four areas of work. So first is improved family functioning, improved child development, and improved child health. Each of those three relates also to clients. And then the fourth category is improved systems of care. And so that particular result area, improved systems of care, is about connections between partners and systems improvement. So it does not cover clients explicitly. So as we see in this slide, total spending was actually quite similar between 2018-19 and 19-20, about $405 million both years. And by result area, the spending was quite similar. Next slide, please. So this particular slide compares the number of children served by fiscal year and also by result area. So this is just to give you an impression. So you can see, so the blue is the family functioning, green is child development, and the yellow is child health. And so looking on the left, we can see that the number of children served declined by result area and the total. Also looking at adults, we see that the number actually increased. So just as a summary figure, about 779,000 children were served in 2018-19 versus 596,000 in 19-20. And for adults, about 41,000 more adults were served in 19-20. So comparing again, 689,000 in 18-19 and 730,000 in 19-20. So maybe we go to the next slide, please. So this slide goes to the next level of the data. So within each annual, within each result area are what's called service categories. And so this graph shows the changes in clients served by service category. So there's a lot going on here, but so let me just describe a little bit what we're seeing. So the blue bars relate to children, the yellow to adults, and then the bars are paired with fiscal year. So for example, if we look at general family support as a service category, we see in the blue bars that the number of children declined between the 2 years. However, looking at the yellow or orange bars, as they may appear on your screen, the number of adults increased. And similarly, so actually this is the largest area where we saw adult services increase, is the general family support. But then the service categories where we did see declines in child services were general family support, as I've just mentioned, quality early learning supports, which would include efforts like Impact and Quality Counts California, oral health education and treatment, and early intervention. So this is just meant to be a high-level summary about the patterns in the data that we saw. If you have particular questions or comments at this time, I'm happy to try to address them with also with Camille. She may want to make comments. And then following your comments and questions, you may want to then consider the motion for approval of the annual report. Thank you.
Thank you very much.
So, okay, so, yeah, so we just skipped a slide there. So Simon and I are in different rooms.
Do you want me to go back? Sorry.
David, do you want us to move to the summary slide?
Yes, so you can go to the summary slide. So really this is what I had just mentioned. So what do we see? Really expenditures were roughly similar. We saw about 183,000 fewer children served during 19-20, but more adults served, about 41,000 more. The increase in services to adults was in the general family support service category. The decreases in services to children were in general family support, quality early learning, oral health, and early intervention.
Through the chair, if I may, I have a question.
Sure.
So David, not knowing what the trends were from 1718 to 1819, I have a question for you in terms of the decline in the number of children served, and if that was directly related to shelter in place and other measures that were taken in response to the pandemic.
So, so Camille and I were just discussing this. So really the way I can answer is that these are changes that we see in the data. So go about your comment about prior years. Well, typically the data are pretty stable year to year. We haven't seen such a big shift in services provided, at least by client counts, until this year. So this seems to be unique. So by implication, we would infer that this has something to do with the pandemic. If you have a chance to read through the county highlights, which are in the back part of the annual report, almost all of the counties describe the impact of the pandemic on their programs, including many counties addressing family needs or provider needs such as supplies. Also, the childcare providers having to close their services, which would of course impact children. So it's hard for me to answer in great detail, but I can just say that this is something that we haven't seen previously as far as a trend.
And I think Commissioner Jimenez, you asked the right question. So as we just, so we collected this data and now we've seen it. I think the next step is to go back and work with our association partners to figure out, is this actually a result of the pandemic? And if so, what are the other things we can learn from that as far as recovery? So right question. We just haven't got to that step yet, but we wanted to bring forward, because we're required to, the report with the data as is.
And if I may just make one more comment. So, this is fiscal year 1920, where we first went into stay-at-home shelter-in-place orders in March. So really a small fraction of that current fiscal year. And here we are now in 2021. And as you can imagine, where I'm going is, we're far fewer children served in the current fiscal year. And I'm hoping that our partners began to look at that and notice that downward trend, and hopefully became creative in terms of how we can continue to serve children in the current year, considering that we're still kind of in this, we're at a regional stay-at-home order, but still really not encouraging people to leave their house unless they really have to. And more importantly, be thinking about, how do we need to shift going forward, considering that these that we're going to just have to learn to do business differently going forward in this space and all spaces, again, to ensure that we are meeting the needs of our children and families into the coming months and next fiscal year.
Anybody else?
Thank you, Commissioner Jimenez. Do we have any other questions or comments from commissioners? In that case, do we have a motion to approve the annual report and its submission to the governor, the legislature, and the county commissions as required by statute?
Commissioner Jimenez, so moved.
Oh.
Is there a second?
We can do.
I second.
Okay, Commissioner Hazen, second. Jamie, if you could do the roll call.
Can I just announce that we do have one person for public comment first?
Oh, I apologize.
Okay, Angela Glore, we'll bring her up right now.
We're gonna, right. There we go. Okay, there she is.
Oh, there we go. Thank you. I didn't realize I can't see that I'm muted in this format. Thank you. I'm Angela Glore. I'm the Executive Director of First Five in Del Norte County. And I love seeing this commission in its new format, in this new sort of full partnership. And I just wanted to respond quickly to Commissioner Jimenez's question about the decrease in service. It is absolutely in our county, and I think in most of my partner counties, because of COVID. There are a lot in that last few months, everything was happened so quickly. It was really difficult for some of our funded partners to sort of think about how to reframe their programs to serve families. Most of them have really changed the way that they're serving families in this fiscal year because they had time to think about it, and it became clear that it was not a short-term issue. So I think that those numbers, at least for us, should rebound this year, but it was absolutely because of COVID and not being able to turn quite fast enough to serve children particularly, but absolutely increased our support of parents and families and providers. So thank you for the question, and I hope that helps.
Next, we have Melissa Stafford Jones.
Thank you again, Melissa Stafford Jones, First Five Association of California. I also wanted to maybe connect to part of Camille's report earlier in the day about the data work. And I think that the other ongoing evolution in First Fives is, as we continue to provide a combination of direct service, but also increasingly focus on systems change and systems development work, I think how we capture data that reflects that work is a little different than counts. And so I think there's just an evolution that we are all in to understand how to appropriately and best capture that. So we see how those shifts are happening, how they're evolving, how we take them into account, how we know if they're impactful. So I think we know it's really challenging to collect data on systems impact, but I think we're hopeful that that's part of the conversation as we increasingly think about the role of data and the kind of data that together we're collecting and looking at together. Thank you.
Next is Carla Ritz.
Hello, this is Carla Ritz, Executive Director, First Five of Lake County. And I just want to reaffirm what Melissa just stated. In our county, I know next year I'm a little nervous that our numbers are going to look lower than they were. Part of that's COVID, but part of it's also because we had been previously funding a program that we then helped become a nonprofit on their own and find their own funding to sustain themselves. And that was almost 1,000 mothers that they were serving, and they continue to serve them. And so those mothers are still being served, but not with First $5. So that's a systems effort that we undertook, and I'm not exactly sure how to capture that in next year's data. So there's a lot of complexity there for sure.
That's all for public comment that we have now.
Great, thank you, Camille. Jamie, do you want to call the roll on the vote?
Yes, Myra Alvarez.
Aye.
Nadine Burke Harris.
Aye.
Monica Fitzgerald.
Aye.
Sheena Hazen.
Aye.
Jackie Majors.
Aye.
Elsa Jimenez.
Aye.
Molly Munger.
Aye.
The motion is carried. And now we will, so thank you very much, David, for your wonderful presentation. Now we'll move forward to the financial update. Financial update is a standing item, and as requested by commissioners, we have this item early in the agenda so that we can have financial data available when considering funding requests throughout the day. So I'd like to welcome Marcia Thomas to present our financial update.
Okay. There's Marcia.
Okay. Can you hear?
Yeah, there are your slides.
Okay.
So you're good to go, Marcia.
Okay. Good afternoon, commissioners, and welcome Dr. Burke Harris and Commissioner Mendoza Jimenez. It's a pleasure to be with you today. Not too much has changed since our October commission meeting. However, I do have a few updates and slides I would like to share with you all. I would like to thank Commissioners Munger and Hazen for their help and advice on preparing our slides. The first slide, slide number 2, is a graph representing our Prop 10 and Prop 56 revenues, which are transferred from the California Tax and Fee Administration, known as CDTFA, on a monthly basis into the California Children and Families First Trust Fund. The data for this graph is taken directly from the total revenue amount column on Table 1, which can be found on the financial update, page number 2. And I just want to quickly point out on the financial update, 2019-20 is shown as projected, but it's actuals. It didn't get moved up into actuals, but the amount is correct. So I just wanted to point that out really quickly. So the projected revenue is from 2020, 2021, all the way to 2024, 25. We get these projections from the Department of Finance. The amounts displayed in the table and represented on this graph are capturing both Prop 10, Prop 56, as well as surplus money investment fund, which is our interest earnings, less the statewide assessments and the administrative costs incurred by CDTFA. This graph captures both the state commission and county commission revenues combined. The increase you notice between 2018 and 19 and 2019-20 is attributed to Proposition 56 backbill being significantly higher in 2019-20 than the previous fiscal year. Slide number 3 is our revenue projections for the current fiscal year 2020-2021. It displays the various components that factor into our projections that I mentioned in slide number 2, such as Prop 10, Prop 56, surplus money investment fund earnings, statewide assessments, and administrative costs. It displays what is available to transfer to both the state and county commissions. For the current fiscal year, the total projected amount available to transfer is $387 million. In the governor's January budget, the revenue estimates for tobacco tax revenue for the California Children and Family First Trust Fund remain the same as what was projected in May 2020. There were no changes made and the estimates continue to reflect $318.1 million for Proposition 10. The only update made to this projection versus what was presented in October 2020, the commission meeting, are the Proposition 56 figure and the backfill amount. Since the amounts were known and the funds were transferred late December, we updated that portion of the projections. Previously, it displayed $85 million for Proposition 56, and we received $93.884 million. It further breaks out the 80% that goes to the county commissions and the 20% that goes to the state commission. As mandated in Prop 10, the 20% is divided into 6 fund accounts: our media, education, childcare, research and development, unallocated, and administrative. The state commission is projected to receive $77 million this fiscal year. Slide number 4 shows the statutory distribution for each of the state commission's accounts per Health and Safety Code 130105. And next to that illustrates the percentage as a whole or a total for the state commission. For example, media is receiving 30% of the $77 million. It also displays the projected statutory allocation for each account from the $387 million, which we saw on the previous slide, for the current fiscal year. Slide number 5 is a 2-year comparison of our Proposition 10 revenue for fiscal year 2018-19 and then 2019-20. This chart shows how the transfer of revenue can fluctuate monthly, with the biggest fluctuations usually occurring in the months of November through January. This can at times make it difficult for First 5 California and the counties to budget and plan ahead. Several factors can influence the revenue fluctuations, such as when the administration fees incurred by CDTFA are recorded, when statewide assessments hit the account, and timing of when revenue is received and recognized by CDTFA. Slide number 6. Slide number 6 is showing the first 5 months of the fiscal year with a comparison to the first 5 months of last fiscal year to again show the fluctuations. Last year and again this year, November's revenue is low because of the timing of the holidays. This means that December's transfer, when we receive it, will be higher than normal because it's going to include the additional revenue from November. Currently, for the months of July through November, CDTFA has transferred a total of $125 million to the fund, which is a 13% increase from this time last year. This is partially due to when the administrative fees and the assessments are deducted from the revenue transfers. With our first 5 association partners, we have been in monthly discussions with CDTFA to address these fluctuations in low revenue for certain periods and months, such as November of this fiscal year. Our monthly revenue discussions have resulted in more consistency in the assessment of fees, as well as transparency and clarity around the revenue amounts transferred to the California Children and Families Trust Fund. The State Commission recently closed fiscal year 2019-20, which brings me to our final slide, slide number 7. The total prior year carryover in yellow reflects our beginning balances for fiscal year 2020-2021. This amount is the sum of the beginning balances for all of our funds found on the financial plan, attachment A, and the fund condition summary, attachment B. The numbers from the slide are found on the last page of the fund condition summary, attachment B, sorry. Total revenue in green is the sum of Prop 10 and Prop 56 revenues, the total interest and the federal reimbursement for the kit for new parents. Expenditures per year are broken out into 2 categories on this slide. Committed expenditures is the black line, and under consideration expenditures is the blue dotted line. Committed expenditures are defined as projects already approved by the Commission. Under consideration expenditures are projects earmarked by First 5 California staff that have not been approved by the Commission or the First 5 California Executive Director. For example, these projects typically include those investments that may be ongoing, such as Kit for New Parents, media campaign, also known as Talk, Read, Sing, and small population county funding augmentation. The 15% reserve is taken from the projected Prop 10 and Prop 56 revenue. It is identified in red on the chart. This reserve is assessed each fiscal year and does not roll forward from one fiscal year to the next. The net after reserve is the projected available balance. And we look forward to continuing to work with our Fiscal Advisory Committee on how to best present our financial plan to ensure that the commissioners as well as the public understand our financial data. So that concludes my presentation and my update, and I'm happy to answer any questions you may have.
Thank you very much, Marcia. That was very informative. Do any commissioners have questions or comments about the fiscal update?
Right. Oh, I do too.
Sorry, you know what? I'm now on whole screen, so I couldn't see whose hand was up first. But if who is first? Okay, Commissioner Jimenez, do you want to go ahead?
Sure. I have just a point of clarification, Marcia. Thank you. That was a very nice summary. When you said the reserve doesn't roll forward, can you explain to me what that means?
Yeah, so every fiscal year, we look at the revenue that's projected to come in and we take a 15% from that revenue. So in the beginning of the new year, we're looking at the revenue from the current fiscal year. And we're taking that as the reserve, the 15% reserve. So it's not rolling forward and then we're adding more to it. It's just every year we're assessing it on the projected revenue that we're expected to receive.
Okay, so it's reset based on the actual,
It's reset. Yeah.
based on the projected revenue. And then is that 15% by policy?
I believe that's an internal decision that we made. Correct me if I'm wrong, Camille.
So that has been, as far as I know, a standard process that we've done before I gone here. Prior commission has had a conversation though about, because it's not mandated in the proposition. It's not something. It is something that we've always done. And so there has been some initial conversation about, is that something we continually want to continue? Is 15%, for instance, the right number? Do we want to do anything at all? And so I think looking forward to this coming year, that with our fiscal advisory committee will be something that we have a conversation about and bring forward to the commission for consideration going forward.
Thank you.
Was there another question or comment? Commissioner
Yeah.
Higgins?
Yeah, I just wanted to make sure, or I guess ask both for new commissioners and those returning to see if this felt clear. I know Commissioner Munger and I have been working with the team to try to make some complex information easier for everyone to understand. So just wanted to make sure that it is getting easier to understand.
I will say, as a new commissioner, it did feel clear to me. It was very helpful. Thank you.
I echo that sentiment.
I think excellent. And I would say to Commissioner Munger, I think that the lack of questions is a good sign. And for the newbies, typically it's, what does this mean? And why is this here? So making progress.
I do have a question, and I recognize that I am not a financially inclined person, so not as clear to me as my fellow commissioners, but I'm working on that. But in the financial plan handout, attachment A, there is an unallocated balance of about 18 million for 2021, and then 22 million in 21-22. And this may not be the appropriate time to have this conversation, but I'm curious, again, we are still in the pandemic. We are still seeing families grappling with multiple challenges. Are we gonna have a conversation about that unallocated amount and the opportunity for the First Five Commission to support our network, our families, our kids? And if so, when does that conversation happen?
I think certainly.
And did I get the number right?
Yes, you got the number correct. I think going forward, again, as we look at investments to come and to our strategic plan and what we have moving forward, there will be a conversation about how do we want to look at those balances, and where clearly should there be investments in the future. So, or, now, because the need is now. So I think that we're hopeful with our advisory committee going forward that we can lay out, as we look at the financial plan, make that, working on that document as well, to make sure that there's clarity there. But also it's more of a strategic planning conversation to say, funding is available. This is where we are with our strategic plan. What's the capacity we have as an agency to move things forward? How do we do that? So I think those are all conversations that are coming forward, Myra. And we have, I don't want to put it so far out, but we do have, as I said earlier, an opportunity to look at our strategic plan again, to kind of re-evaluate where we are midstream, And then to say, is this the path we still want to stay on? Do we need to amend it? Look at, and if so, how do we use our investments most wisely? So I think the answer is yes to your question. Those conversations will be coming forward.
Thanks, Camille. If I'm understanding you correctly, just so that I know sort of like the next steps on that, the Strategic Planning Committee could schedule a meeting next week to discuss what they think are some suggested ways to spend that money. As a commission, we're deferring to them, fully trust their leadership. They then could say, let's call an emergency meeting of the commission to bring these ideas forward to the commission, and we vote. So it could work as quickly as that. Am I understanding the process correctly?
Well, yes, that could happen. I would say probably moving that quickly is I would want to make sure that we have full conversations. But the other part of that, I think, is it's not only, and I said, you know, in looking at our whole strategic plan and where everything fits, that doesn't eliminate any other advisory committee, commission as a whole from getting together and saying, from the program committee coming forward and say, look, we've looked at the master plan. We really think this is something that we need to do, or California First Five needs to take the lead on. We want to think about that, and we want to bring it forward to the full commission. I don't want to make it sound like it eliminates any other commissioners or advisory committees from having those conversations. I think though, I thought when you asked the question about the process, we probably would look at our we will look and continue with the strategic plan advisory committee to look at it and see where are we on track, where, you know, how are things lining up, and that would be part of their work as well. But it certainly doesn't preclude any of the other advisory committees from coming forward to the commission. Okay. Jackie's got her hand raised.
I do. I was just going to add that, you know, the staff has been really good, particularly with COVID, about elevating things, particularly to the program committee, as to, look, we're hearing from the association, we're hearing from the different counties of these issues or these needs as they relate to COVID. They've also been incredibly good about revisiting other budget items and seeing and projecting where there was going to be unspent funds. And we were able to make some really quick shifts to reallocate those funds. So I just want to say that just from a program standpoint that we, you know, staff did elevate those, but I think there's still an incredible opportunity for all commission members to be able to say, hey, you know, I'm hearing this in my world, maybe that's something we can consider. You know, I certainly subscribe to the beauty of advisory committees to be able to dig down and vet. And then there's the beauty of having everybody from their own vantage point to be able to create ideas and opportunities. And so I just wanted to say that, because I also think while we are often very reliant on the staff to sort of bring to us these ideas and these recommendations and these proposals, that maybe, particularly with the program committee, but maybe others, we can take some time in those spaces to elevate other commissioners' ideas, so that staff are, you know, also having the opportunity to research those and bring them back to us instead of the other way around exclusively.
Chris has, Commissioner Perry has her hand up as well.
You can call me Chris, it's fine. Thanks, Camille. Hi again. You know, having just done the master plan over the course of last year, and attempted sort of what's being attempted here, sort of bringing together vertical sort of thought into more of a horizontal integrated view of a system, the early childhood system. It's really hard to do without almost a brain trust set of experts or folks that are tasked with that work day in and day out, the horizontal work. And so, I'm really processing tonight. I actually went back and looked at an old org chart from June, Camille, that you gave us, and feel badly that I didn't get the number right earlier, that you're working with, only, a few dozen staff. That if there were a way to devote some resources to the holding of strategic thinking, planning, and maybe even some acceleration there, outside help, consultant help, contractor help, so that the staff aren't trying to do yet more on top of what they already have, but we're also holding this, you can hear, I think, the desire to get to a more integrated place. I, for one, would be so encouraging of your, sharing with us who you've worked with that you trust. And, I know GPG has played an important role for the commission at different times. We've done strategic planning, but there are probably others that you've worked with that do too. And I just would love for us to have somebody almost, shoulder to shoulder with you as a thought partner, as an executive, thinking about, managing the commission's desire to integrate across all these domains, versus trying to do that. I could see there's a lot to hold. And there are new plans coming out every day that we want to integrate with too. So I just really encourage some exploration there. Maybe the executive committee could talk with you a little bit about that and who might be helpful to you. And we have these resources that are unallocated, and we need help.
Thank you. Appreciate that. I don't think
Any further comment from commissioners or questions?
Well,
Go ahead, Commissioner.
I don't know whether I'm muted or not. I just want to say on a positive and kind of acknowledging something positive in the moment that's really present here, is that we are met with a lot of opportunity as well as a lot of challenge. Yes, a lot of challenge, but a lot of opportunity. And I think, as Chris is lifting up, and it has been lifted up by several others, also a time when we're thinking better about these things. I think the commission has felt that we are thinking much better about people being left behind, how they've been left behind, what we do about that, how the systems have become, or maybe were always designed to be, very dysfunctional, really. And this time of opportunity happens to be landing at this commission at a time when years ago we made a policy decision to underspend our money. The reason you see those big yellow bars of unspent money carrying forward year after year, so that we have not only revenue coming in, but every year carrying forward unspent money, is because it's been the policy of the commission to underspend the money, because we felt very embattled. We knew our tobacco revenues were shrinking, and there was a sense of crouch, defensive crouch, and so we must underspend. And as it's understandable, it led to very large balances. We have a lot of room ahead of us where we can redeploy. So it's kind of wonderful to have a new chair at this moment, because you're coming in at a time when there's both challenge and some wonderful tools now to address them with, both in terms of the mind share that's on these problems, the various silos melting and coming together better. And your particular commission is not in a budget crisis. It actually is sitting on some nice reserves, or carryovers, as we better call them. So anyway, welcome. I think
Thank you.
It's a good time to be here. It's a good time to be here.
Thank you. I think
very well met for the moment. Very well met for the moment.
I think in response to those that statement, I'll say I'm heartened to see that we have some fiscal reserves, and I'm heartened to hear your explanation of that. I think that certainly for myself as chair coming in and as a new commissioner, I feel like particularly the COVID pandemic represents a very, very important challenge and opportunity for us to look at how we think about, as President Biden would say, building back better, and recognizing the threats and the challenges that the pandemic has posed for our vulnerable Californians, and particularly at this time, our youngest Californians facing parents and families who are experiencing unprecedented economic hardship in record numbers. We know that the pandemic did not affect Californians equally, and that those who are worse off were most affected. In addition, being so pleased to hear the work about equity, which is a central priority for me in my day job as California Surgeon General, because it has been an unprecedented time in terms of understanding the impact of systemic racism and witnessing how powerfully that continues to play out on a day-to-day basis. And so I do feel like we have some big challenges ahead of us, some exciting work to do, and glad to hear that we have a little bit of fuel in the tank to be able to do it. Any, moving now to public comment?
No public comment at this time.
Wonderful, thank you. In that case, we'll move forward to our state and federal budget and legislative update. As you know, the state and federal budget and legislative update is a standing item at each commission meeting. And as it is the start of the budget season with release of the governor's budget, staff have a lot to share with us today. So I'd like to welcome Alex DiCaprio to present the budget and legislative update. Welcome, Alex.
Okay. She's coming.
There we are. Can you hear me okay? Great. Well, good afternoon, commissioners. Happy New Year. For the new faces here, my name is Alex DiCaprio, and I'm the legislative coordinator here at First Five California. Oh, there we go. Thank you, Simon. And we are lucky to also be joined by Sharna Whidbey, Chief Government Affairs and Public Policy Officer at First Five LA. It's hard to believe we're beginning a new 2-year legislative session, but just like that, the 2021 legislative session has begun. So shared on the screen here is a revised draft of our 2021-22 Children's Policy Agenda for review and consideration. Please note the policy agenda included in your item as attachment A does not include recent edits from the Legislative Advisory Committee. So please refer to the draft emailed to you yesterday or the one shared here on the screen. The Children's Policy Agenda is intended to be used as a high-level framework to guide the Commission's advocacy in the priority areas of early learning, child health, and resilient families and communities. First Five California's policy agenda has not changed significantly over the past 2 years. However, this year we've made some minor edits to provide clarity and better alignment with our First Five network partners, as well as to emphasize the Commission's commitment to equity, which you will see in the introductory language. Additionally, based on feedback from our Legislative Advisory Committee, which Commissioner Hazen can speak to in a second, we've incorporated language around family strengthening policies that include economic security, recognizing that historically marginalized communities are the communities that we're focused on, as well as some language around the pandemic and reaching those most impacted. We won't be asking you to vote on this, but if you have any feedback on the policy agenda in front of you, we're happy to accept that today. Commissioner Hazen, would you like to say anything about the draft policy agenda the Commission has in front of them?
Sure, thank you. And I want to thank both Sharna and Alex for their receptivity to my feedback. And we had, I think, a really generative conversation, really looking at our policy agenda with fresh eyes. And so while the edits are minor, and making changes to what was in previous years, I did want to call out some of the changes and some of the language that was made more explicit. So one of the things that was really important to me, and I think to us, is recognizing the current ecosystem in which children exist, right? That we aren't only tasked with shaping policies that directly affect children, but families as well. And particularly looking at families that have been disproportionately impacted by COVID. So looking at those struggling families, struggling as a result of poverty, systemic racism, and COVID, and calling those things out. One of the things that I noticed in looking at an earlier draft of the agenda is, if you didn't know we were in the middle of a global pandemic, that wouldn't have been clear from this policy agenda. And so we've gone through and reflected that, and you'll see that in the way that it talks about health and safety, both for children, families, but also for providers as well. Also calling out addressing poverty through a multi-generational lens. And as Alex said, really all of this viewed through a lens of equity. So I'm excited about the new revised agenda. And as we've heard from updates throughout the day, both from First Five staff, from the association, I think it really reflects an alignment across the board.
Thank you, Commissioner. That was really helpful framing, and I think a good summary of the conversation we had. We are going to provide a quick state and federal update, and then we'll leave some room at the end for feedback and questions on the policy agenda as well as the rest of the item. So with the legislative session underway and COVID-19 still impacting everyday functions, we anticipate another chaotic and unpredictable year in the state legislature. While leadership and staff have done their best to learn from some of the rockiness of virtual lawmaking and advocacy, there will continue to be challenges related to hearing room capacity, technology, and public engagement. Attachment B includes a list of the bills we're tracking in this legislative session thus far, guided by our policy agenda, with a few highlighted in more detail in the item itself. With many bills light on details, we will continue to track and monitor for support position consideration, and we anticipate having more details to share about bill positions at the April Commission meeting. Of early bills introduced, we're seeing movement on pieces of the master plan for early learning and care, primarily around universal preschool and the expansion of TK and the supports that go along with that kind of expansion. Continuing on the big paid family leave wins we've seen the last 2 years, we're excited to see Assemblymember Gonzalez introduce a bill to tackle the low wage replacement rate that makes paid family leave out of reach for so many families, policy that's consistent with the recommendations to come out of the governor's paid family leave task force that First Five California sat on. Additionally, some exciting and important legislation around universal basic income and disparities in equity and health are likely to be top of mind this year. The deadline for new legislation to be introduced is February 19th, and we will of course keep you apprised of any developments. Moving on to budget, on January 8th, Governor Newsom unveiled his initial budget proposal for the 2021-22 fiscal year, proposing a $227 billion spending plan that focuses both on near-term immediate needs related to the COVID-19 pandemic, as well as long-term structural investments. After closing a projected $54 billion budget gap resulting from the pandemic and subsequent recession, the governor was left with a one-time windfall of $15 billion. A full budget summary is provided in your item, but overall, the budget proposal recognizes the need to support our at-risk families and promote equity throughout the range of services and support that children and families interact with, particularly as the pandemic disproportionately impacts low-income communities and communities of color throughout California. Such components will help support the needs of the whole child and the whole family. In his proposal, Governor Newsom directs significant funding to COVID-19 response and relief, including vaccine distribution, personal protective equipment, testing, contact tracing, and hospital surge preparation. With an eye to the pandemic's economic disruptions and immediate relief, Governor Newsom has also called for a total of $3 billion in funding to support small businesses and low-income residents most impacted by the pandemic, including funding for a new Golden State stimulus program that would provide $600 in direct cash assistance through tax refunds to workers who received the California Earned Income Tax Credit in 2020 or 2021. In addition to these economic supports for families, the budget focuses on avoiding further loss to the early learning system and builds on recommendations made in the Master Plan for Early Learning and Care. While California's financial condition is much stronger than was anticipated at the start of the fiscal year, primarily due to the stock market strength, greater than expected tax revenue from the state's highest income residents, and lower than expected enrollment in state programs, Governor Newsom has cautioned that California's financial situation remains in flux, and state officials anticipate a budget deficit as soon as next year. The Newsom administration is likely to continue its federal advocacy for both state and local funding and increased flexibility in how California can spend COVID stimulus funding. President Biden and members of Congress have said state and local funding must be a high priority for any future COVID relief legislation. And with Democrats now controlling the federal government, the probability of additional stimulus has increased. Absent further federal action, state budget deficits could threaten First 5 California priorities in future years. As such, First 5 California's state and federal advocacy strategy will continue to focus on educating policymakers on the need to prioritize both short and long-term improvements in essential child-serving infrastructures and systems to meet the needs of families during the pandemic and beyond. First 5 California is continuing to work with the First 5 Network and the ECE Coalition to get consensus around a unified state budget ask for this year, as well as federal priorities that are still in development. We'll be sharing updates with you between now and the April Commission meeting, and you can expect to have a more detailed update on asks and priorities at the April meeting. Speaking of federal priorities, the federal landscape looks quite a bit different since we last spoke, and there have been some key updates since the item was printed. With a new administration and a new Congress, including several California natives, there is new and exciting opportunity at the federal level. And in just 8 days of the new administration, there's a lot to be encouraged by. While we remain hopeful of and are continuing to advocate for a bold stimulus package that further supports children and families, and are excited by the proposal put forth by the Biden administration, we are also encouraged by many of the executive orders that have been announced, as well as legislation and plans being introduced that directly impact families. Since taking office, President Biden has announced several executive orders, including launching an initiative to advance racial equity, revoking the order that aims to exclude undocumented immigrants from the census, providing guidance on safely reopening schools and childcare, establishing a COVID-19 health equity task force, addressing discriminatory housing practices, and more, as well as the introduction of bold immigration language. Additionally, in the coming days, we expect to see executive orders that begin to roll back the harmful public charge rule implemented by the Trump administration, and the creation of a task force to reunite migrant families separated at the border. As most of you know, First 5 California currently has an RFP out for federal advocacy services to expand our capacity to engage in Washington, D.C. on behalf of the entire First 5 network and in support of the state administration's priorities. Proposals are due today, actually, and we are on track to have a contractor in place by April 1st. In the meantime, we continue to work with the First 5 network, as well as with our external partners, on federal strategy and engagement. We know that early learning, health disparities, family resiliency, and economic security strategies, as well as immigration, are priorities of this administration, and that we will need to be leaning into these areas and working with the First 5 network and our advocacy partners to develop a more sequenced, long-term plan of engagement. We know that many of you have expertise in these areas, so we'll be looking to you in this next phase to deepen our federal work and participate in the network strategy development and engagement. With that, I will stop there and open it up to questions, feedback on priorities, and reflections.
Thank you very much, Alex. That was very thoughtful and engaging. I want to open it up if there are any commissioners who have any questions or comments. I'm looking, Commissioner Jimenez, I see your hand raised.
Thank you. You know, one of the disparate impacts we've seen with this pandemic is how expansive the digital divide is, particularly for our communities of color. And then going back to also Commissioner Morales, I believe from Fresno, making the point of further advocacy in the digital divide space. I'm wondering if there's an opportunity on our policy agenda under early learning to perhaps incorporate language around advocacy for addressing digital divide, whether that be through it be a utility where it's just everybody has it, or seeking what opportunities there may be to be able to help close the gap, particularly for children of color and children that reside in very remote rural areas.
Absolutely. Yeah, I'm taking notes, but no, I think that would be a great addition. And I think you're right. I think the early learning space is, I think we can absolutely weave that in there.
Thank you.
Thank you. And I will acknowledge myself as I have my own hand raised here. And that is in looking at the priorities regarding child health, I see that supporting and promoting universal development, behavioral, and ACEs screenings and connections to appropriate services is one of the priorities. And I think I'm very pleased to see that included. I want to highlight that screening for ACEs, and as you know, as we see with the network of care grants that were just released by the ACEs Aware initiative, and it's really only the first step. I think there's been a lot of conversation about the ACE screening, but the purpose of the screening is really about identification of risk for the purposes of early intervention. And I think that we talk a bit about connecting families to services, but one of the things that I want to highlight and I really want to shine a light on in this commission is that the data is overwhelming. We have such strong evidence that shows that exposure to early adversity, and as I think everyone on this commission recognizes, that the pandemic has seen an increase in ACE exposure for children, right? So we're seeing increase in intimate partner violence, increase in mental health disorders among adults, increase among substance dependence. There are, we're seeing reports on increases in family discord and divorce and separation. And then of course, the reports in regards to child maltreatment, we've seen a dramatic decline in reports of child maltreatment as children are not coming into contact with the safe and trusted adults who would make those reports, right? And instead, what we're seeing, we have data from the CDC that is showing that for children who are hospitalized due to injury, the severity of those injuries is increasing, right? So it's really, really an incredibly challenging time. And one of the key pieces that I want to kind of close the loop on is not just the screening and the referral to services, but really how the healthcare team and the community supports works together to have bi-directional communication to get to improved outcomes. And that is one of the things that I think is absolutely critical is right now, I think we're at a place where, I think there are many who view, even if they screen for ACEs, which is very exciting that California is moving forward in that direction, that they refer to services, they check a checky box and then go about their, feel like they've done the job. And so we really want to see moving towards that closed loop coordination of care that drives towards improved outcomes, which I think relates to, ultimately will relate to, how do we measure that? How do we evaluate that? How are we holding ourselves and our partners accountable for that? And that is one of the pieces that I think as we think about our policy agenda, thinking about how do we work with the efforts that are happening in the state. I think that we're very fortunate to be, you know, in California, where California is absolutely taking the lead in a nation leading and in fact world leading effort that we are doing with ACEs Aware, to partner with that effort to ensure that we can drive towards improved outcomes for children.
No, that's such an important point. Thank you for highlighting that, and we'll make sure to, you know, that language is inclusive of that.
Commissioner Majors, I see you have a comment.
Oh, thank you. I totally agree with our chair's perspective on ACEs, and, you know, being sort of the early learning person here, I really want to emphasize the important role that the childcare workforce plays in closing that loop for children with multiple ACEs. And even before some of these studies had really sort of, you know, progressed to the place that they have now, and we have this screener and we have this process, you know, early childhood providers were experiencing the impacts of these traumatic experiences that these young children were having. And while not equipped with all the tools they needed, they were the first responders to these things. And so it's really important to me, you know, that we continue to, as we're looking at this policy agenda, that we are including workforce, childcare workforce in our mind, along with healthcare providers, you know, but really making sure we understand the important role they play in not screening, but identifying, and also the ones that are going to be very instrumental in sort of addressing and acknowledging outcomes, and the dollars and the investment in the workforce to be able to support that effort in our policy agenda. So I just wanted to highlight that.
That's a really great call out. Thank you.
Thank you, Commissioner Alvarez.
Thank you very much for the presentation, Alex. That was really informative and clearly a lot of work from Commissioner Hazen and others in developing it. To Commissioner Jimenez's point, I wanted to just a +1 to that, recognizing also that in our virtual environment, so many of our support services, our healthcare services, our learning services are moving in that direction of being dependent on technology, not just education. So wanted just reiterate that. And then building on Commissioner Major's point and our chair's great points about preventing ACEs and making sure we're handling them. You know, we were incredibly grateful for the governor's $400 million investment in looking at how behavioral health services can be tied to schools. And we think that's a tremendous opportunity, a tremendous advocacy opportunity to say, let's do schools and early learning providers. Let's do schools and childcare providers, right? In order to ensure that the investment in mental health and social emotional development starts with our youngest. So I think that's an opportunity to really call out in our agenda the importance of what this pandemic is doing to the mental health of our youngest children. That doesn't always manifest itself in the same way as it does in our older kids, and could be something that we collaborate with the Mental Health Commission. Forgive me that I was going in and out of my screen. There's a Mental Health Commission meeting happening, and there was a really important vote on that initiative that I think called out the importance of early childhood with Commissioner Gordon and his work in Sacramento. So I think there's really good energy around the leadership of our now Commissioner Burke Harris, but our Surgeon General, the awareness that every child is traumatized right now as a result of this pandemic, and then what our state can do to respond. So whatever we can do to support you in that important effort on behalf of the commission, please know that we're here to support you.
Absolutely. Thank you so much, Commissioner Alvarez.
Thank you. And I think we will take one more comment from Commissioner Major before we move on so that we can do our best to stay on schedule. Oh, Commissioner Major simply had her hand still up. Okay. In that case, we will move forward to public comment. Camille, is there any public comment?
No.
Okay.
No public comment.
In that case, we will move forward to our regular agenda. Protocol for action items includes staff presentations, questions from the State Commission, public comment, deliberation, and voting by the State Commission. There'll be a 3 minute per person time limit during public comment. And we will start with our small population county funding augmentation authorization. This is item 8. And as most of you know, the First 5 California Commission has approved funds for small population counties since its inception, which enables every county to operate a First 5 County Commission. The small population county funding augmentation enables small population counties to make Prop 10 a statewide effort and ensure all children can be served. During this item, staff will request $20 million for 4.25 years of funding authorization for SPCFA. I'd like to welcome Debbie Silverman to present the item. Debbie?
Do I need to? Before Debbie we're getting Debbie up online, just to remind commissioners, in the information we sent you last night, there were 3 letters that were regarding this item, from 2 from legislators, I believe, and 1 from a county. I just want folks to know commissioners have received those letters. They've just come in recently, and we will post them as part of this item after the meeting. So wanted folks to know that's how we're going to handle those letters. So.
Good afternoon, commissioners. I am just queuing up the PowerPoint on the screen. So if you could just bear with me while I do that. Do you see the PowerPoint?
Not yet.
Not yet. Okay. I'm trying to share my screen here.
We'll try to get it too for you, Debbie, on our end.
Okay.
There we go.
Beautiful. So I'll start from the beginning. How about that? So good afternoon, commissioners. My name is Debbie Silverman, Education Administrator. I do work in sort of the research and evaluation arena and also the program arena. So those of you on those advisories committees might see me in both of those places. But today I'm going to be presenting an action item about the small population county funding augmentation that I will refer to as SPCFA. Oh, whoops, sorry. You can see my talking points, I heard. So how do I change that?
Display. Debbie, if you go to display settings, I think you should be able to switch it to presenter mode at the very top.
I'm sorry.
There you go.
Oh, there we go. Is that better?
Except it went black, so.
What?
What was the first one you hit?
This one?
Yeah, hit it again.
Okay,
No,
and
no, no, go back
unblack
to
it.
that one. No, go
No.
back to that one.
Oh, okay, that one, and then do
Yeah,
what? This?
Just click it.
Okay,
And now go back and just, yeah.
now do it.
Yep.
Is that better?
You got it.
All right, thank you so much. And I'm sorry. Okay, it's gonna go better from here on out, I promise. Okay, so during this presentation, I'm going to give you a brief background of SPCFA for our new commissioners. Welcome, Chair Burke-Harris and Commissioner Jimenez. I'm going to respond to questions raised by commissioners during our October meeting. I'm going to explain to you what constitutes that 20 million 4.25 year ask. And I'm going to share with you the proposed activities that small population counties will be required to engage in, as well as the types of support that we will be providing to them so they can succeed. And then finally, we'll provide a fiscal analysis by each of the accounts from which the funding will be drawn. So again, as Chair Burke-Harris mentioned, we are asking you for $20 million over the course of 4.25 years that begins April 1st, 2021 and will sunset June 30th, 2025. The current funding for SPCFA expires this year on June 30th, and I will explain the rationale for the overlap in funding. Since June 2020, staff have been meeting with a work group of executive directors from small population counties who represent different geographic areas of the state, different lengths of experience with being an ED in a first 5-county commission, and different populations, different birth rates. This work group also included Melissa Stafford Jones, Executive Director of the First 5 Association, who you've already heard from today, as well as Kim Bell-Shea, Executive Director of First 5 Los Angeles. The small population county executive directors wanted to have a representative from a larger county to provide support, and they picked about as large as you get. So Kim Bell-Shea has been participating in the decision-making as well. So we discussed with them what your feedback was from the October commission meeting, and we discussed with them funding scenarios, eligibility, accountability, as well as our declining tobacco tax revenue. Thank you to Commissioners Munger and Majors for their support and guidance during advisory meetings as well. So today I'm coming to you with the ask that you see on this screen. A little bit of history around SBCFA. SBCFA was established to ensure that California Children and Families Act, that I will refer to as the Act, could be implemented statewide so that First 5 services would be available in all California counties. Shortly after implementation of the Act, it became really apparent that the funding formula that is based on the annual number of births to distribute Prop 10 funding was insufficient to meet the needs of counties with birth rates below 1,000. In fact, for our smallest county, Alpine, that has somewhere between 6 and 10 births a year, is really insufficient. So while the eligibility to participate, the funding formula and the requirements have evolved over time, this commission's commitment to support small population counties has been evident since the very beginning. In the current funding cycle, we have 20 counties participating, and you see them here on the screen. These counties are eligible because they have fewer than 1,000 annual births. In the current funding cycle, one of the requirements is that counties implement evidence-based and evidence-informed programs in the areas of early childhood education, child health, and family functioning. These are two beautiful pictures of the landscapes in some of our counties. I don't know if you've managed to go all the way up north or out to the east or west where some of our small counties are, but these are some photos. During the last meeting in October of 2020, you heard from several of our small population counties about the critical role that they play in their communities. Many small population counties would not exist without this funding. And because of their size and the role of the executive directors in these counties, they are able to garner the commitment of partners on behalf of young children, putting the EDs of small population counties in the driver's seat of systems work, convening, catalyzing, and mobilizing resources well beyond the dollars that they receive. The children and families in small population counties are trying to, that small counties are trying to reach are among the most diverse and the highest need in some counties. First Fives, and in some of these counties, First Fives are the only entity in that county that even focuses on children 0 to 5. Data shows that children in small population counties have proportionally higher ACEs, worse health status, and are more likely to face abuse. Families are often separated from each other and from resources by mountains and, in wintertime, snow that is impassable. And when there are natural disasters such as fires, floods, or a pandemic, it has an even more significant impact on families in small population counties. Compared to mid and large-sized counties, small counties lack an adequate tax base, have limited community resources to build or partner with, and cannot access corporate giving or philanthropy. Therefore, this funding, SPCFA funding, is even more critical to ensuring children have equitable access to services and supports, particularly at this time when we're working to recover from this pandemic. So before I go into the details of funding and accountability, I want to address one of the questions that came up during our last time when we discussed small population counties. You asked staff to look into the viability of how can we streamline and reduce cost for services. We were calling it shared services at the time, but because the commission has authorized shared services under the umbrella of the early childhood education that Erin Doobie brought to you some months ago, we're going to call this something different in that spirit. So we're going to call it pooled assistance or pooled services. But know in your mind that it was what you were referring to as shared services before, but again, to try to eliminate that confusion between these two efforts. So I believe you raised this as an issue both of funding equity compared to larger counties, but is also in terms of cost efficiency. We know that as Prop 10 funding declines, First Five California must look at financial models that maximize our revenues. So staff have been working with the First Five Association and counties to really understand the existing services that they already share and what challenges have they encountered when they have tried sharing services or pooling services, but have been less successful. On the one hand, counties report having benefited from pooling services or pooling funds to access services when they apply for grants. As a cohort of counties, they do that in Impact, they did that in the home visiting coordination, where one county applies for the grant on behalf of multiple counties, and that one county administers that grant. Just last week, I learned about several counties who are looking for an auditor. They want to pool their resources and hire together an auditor to serve all of their counties. They pointed to the First Five Association as an entity that they all pay into and then receive this benefit of certain types of services. On the other hand, they've had less successful experiences. For example, it may not be immediately practical to share some services because there are local policy constraints that require them to use funding in a certain way. Some of the counties are under the auspices of their county agencies and so are dictated by those policies and how they carry things out. Others are independent agencies, and there are a variety of approaches that county commissions take in setting up their commissions. We're also sensitive of the fact that there may be unintended consequences to sharing services. That is that if an executive director, say, takes a portion of the work, and this, I understand that this does not seem like it should be this way, but it is this way. And again, some of this is a little bit of local politics, but for example, if an executive director takes something off their plate to do shared services, a shared service arrangement, it may very well be that the county agency under which they work feels like they have less work and so wants to pay them less. So, and this has happened. I'm just going to say that this has happened. And so we are working through some of those things with our county partners. But most importantly, we also need to realize that as we move into this, that counties have current staffing arrangements. And so we need to ease them into moving into a pooled service arrangement so that they have time to adjust their staffing and contractors that they may have on board. So therefore, what we're offering has been suggested by the counties is a phased-in approach. That over the next year, year and a half, we would like to really deeply investigate with the county their experiences, the strengths, the limitations. What are those things that we can actually, those barriers that we can help them to overcome, either by working with their county agencies or by working through some of the other barriers that they have felt. It may very well be just even in how we structure the funding opportunities that can be pooled. We also want to look across other states and other service models about what common support models we could really think through from a county implementation at a county level. And then we would like to come back to you in another year and a half, 2 years, and talk to you about what we learn after we've also had a chance to have some of the counties begin implementing some pilot shared service models, which we will incentivize through additional SPCFA funds or by paying for contractors or in whatever way makes most sense. And then based on what we learn in this 2022 to 2024 time period, that we would require shared service models beginning in 2024. With that, let me talk to you a little bit about the funding method and term. One thing that has changed since our last rounds, many years, 22 years of funding SPCFA with the counties, is we've always been able to provide the counties with funding in more of a lump sum basis based on what we predict and then learn about our tobacco tax revenues. And that was because our contracting methods were that when we contracted with counties, we did not need to go through the state contracting system, that we had authority to carry out those contracts and how the funding was delivered. Several years ago, the state changed its policies on how contracting needed to be carried out and is now requiring all contracts to be carried out through the Department of General Services. With that comes a limitation of being able to provide lump sum payments. And therefore counties will be on a reimbursement-based system, on a quarterly system. So they will need to provide us with a budget and then invoice us for actual expenses incurred. So what we're looking to do is start the contract in April 2021, this year, which overlaps their existing funding by about a quarter of a year to give counties that may have some cash flow issues a little bit of wiggle room, but require them during that quarter year overlap to carry out an activity that is not part of any existing work that they're doing, because we do not want to supplant any funding. And I'll talk to you a little bit about what that quarter year piece will be. In addition, the funding will be for technical assistance, for evaluation, and for those pool services that I just mentioned to you. Eligibility criteria include continuing with a 1,000 or fewer births. As I mentioned before, our tiniest county has only between 4 and 9 births a year, which yields about $4,000 a year. And on average, when we take a look across the 20 counties that are participating right now, that's an average of about 341 births. When you take a look at 2017 through 2019 figures. By using the 1,000 or fewer birth criteria, we have one more county now that now qualifies for SPCFA funding, and that's Mendocino. Mendocino hadn't previously been eligible when we set up the current funding cycle for SPCFA, because the eligibility was based on 2011 births. And at that point, they were in the neighborhood of about 1,100 births. But since 2017, their births have dipped below 1,000, and they are currently at approximately 920. So using this 1,000 or fewer births, we now have 21 eligible counties for SPCFA. Now let me talk to you a little bit about the funding calculation, and I'm going to give you some real life examples of how these things work. So I mentioned to you that SPCFA funding is, proposition funding is provided to counties based on the number of births that each county has annually. And based on the number of births, the total revenue of Prop 10 fundings is distributed across the country proportionally, across the state, proportionally. SPCFA funding was determined to be the difference between a set baseline that ranges between $275,000 for births between 1 and 50 annually, all the way up to $750,000 for counties that have between 750 or between 950 and 1,000 births. So currently they receive the difference between that baseline based on their births and the actual revenue from Prop 10, Prop 56, and the SMIF revenues. Example, let's just say that one county has their baseline set at $350,000 a year because they have, let's just see, I have this written down, because they had 156 births in the year that this baseline was set, $350,000. Well, we find that they received $99,252 in revenues from Prop 10, Prop 56, and SMIF. And so SPCFA would provide as augmentation $250,748 to make up that difference. Now, let's think about the new annual SPCFA. I mentioned to you, we can't do this, set a baseline, and then just give them the difference anymore, because we have to figure out how much they're going to get up front, because they have to create a budget and invoice us against that amount. And so what we did was we took a look at how much they actually received from SPCFA between 2017 and this past year, and we averaged that. So for example, let's go back to our example county on the left. They received 261,521. In 1718, 1819, they received 268,120, and 1920, 250,748, which averages to be 260,130. So for this county, moving forward into the next 3¼ years, we would multiply 261,130 times 3¼ years, and that would be their total contract amount for SPCFA between April 1st of this year and June 30th of 2024. I hope that was clear. Now let's go to how we're going to require they use these funds. Now, one of the things that is really important is that we really support our counties in meeting the requirements of the Act. There are several things that counties need to do to meet the requirements of the Act, and often small population counties are really struggling to do that because many of them have only one staff member, and at that, several of them, it's not even a full-time position. And to meet the requirements of the Act, they need to create an annual report and publicize it. They need to update their strategic plan and provide that to the commission. They need to collect data and submit it into the annual report data system by November 1st every year. They need to provide us with their audit by November 1st every year to maintain compliance with the Act and receive continued funding. We know that counties could use technical assistance. And so we are including in this that they meet the requirements of the Act and that we provide them, with support to do that. I mentioned earlier the pooled services and that we will be asking them to help us by piloting pooled services that can be then later scaled, not only in these counties and potentially other counties across the state. We'd like them to carry out systems impact evaluation. I'll describe that in a moment. Align with state and local efforts. Of course, we want them to align with impact and QCC, with our Talk, Read, Sing media campaign, with tobacco cessation efforts and campaigning, and with our home visiting, should they be receiving those funds, and anything else that the commission has prioritized. And last but not least, certainly not least, to support COVID recovery. Now to go into the systems impact evaluation, this was raised by commissioners at the last meeting, but it's also been raised by our counties themselves, who have been receiving technical assistance on evaluation from our contractor, Child Trends, for the past year or so. In fact, Child Trends was the author of the report that was recently sent to our new commissioners and was presented at our last commission meeting. We know that these counties play a critical role as effective conveners and systems change agents. I mentioned this a moment ago when I was talking about their incredible role in changing the lives of children and families. However, as you pointed out earlier, commissioners, we do not at our level yet collect good information about those systems change efforts, though I believe our data digest efforts are going to be moving closer to that goal. Several small population counties reached out to Child Trends and asked them, how can we assess our systems impact so that we can report it to our local program partners and to our commissions? And so Child Trends has been developing a tool that these counties who were interested in it were going to, try out and see how that worked. Again, this is not a requirement of any contract. This is just an interest area. Earlier, you talked about the impact of COVID-19, and Carla Ritz from Lake County expressed how their systems work has led to the establishment of an agency that took over work their commission once reported to us. Well, this evaluation that I'm explaining will actually help to capture those two phenomena. So the tool which we will now require small population counties to engage with and provide to us, we'll cover these 4 main areas. Why did you engage in this systems change activity? What indicators, what context, what needs were present that you are responding to? What key partners are involved? What actions did you and your partners engage in? And finally, what changed? And these may include indicators of improved policies, services, quality, resources, access, or a myriad of other types of things that ultimately get down to the numbers of children and families, the hardest to reach children and families who are served by this systems change effort. And to the extent and we anticipate over time, this is one way that we can capture that systems impact information. Again, we are requiring small population counties do this as part of their new funding, but we're also seeing it as an opportunity to pilot and refine the tool, and that as part of our data digest work, we may indeed, with feedback from these counties and others, scale this up to provide more comprehensive systems data to you when you, so you understand the impact of these systems investments.
Debbie,
Yes.
I want to thank you for such a thorough presentation. I just want to interrupt you for just a moment because it looks like we're running about 10 minutes over behind time on the agenda, and we still would like to leave time for discussion and public comment. So if we could move quickly through the presentation so that we can leave enough time for the remaining items on our agenda today, I want to make sure that we do that. But I thank you for your thoroughness.
Thank you. I apologize, Chair Burke-Harris and commissioners. I'm almost finished, and these are the easy slides. So again, 4.25 years, 20 million. It'll be divided a little over 18.775 million to the counties, and the remainder goes to evaluation, technical assistance, and shared service incentives and pilots. And they will be distributed across the education account, 40%, research and development, 20%, and unallocated 40%. I would like to point out that in the past, we have drawn SPCFA funding entirely from unallocated, but we are proposing to distribute it across our accounts as follows. So what this graphic shows you, and you have in front of you the impact on the education account when we draw these funds. The gray section of this shows the committed expenditures, and that green line above it shows how the 40% from the education account impacts the continued revenue. This is a similar presentation for the research and development account, from which 20% of SPCFA funding is to be drawn. And this is the unallocated account, from which we will be drawing 40% of the SPCFA funding. And that's it. And thank you for your indulgence.
Thank you so much, Debbie. Questions or comments from commissioners? Hearing none. Oh, I see Commissioner Perry has a hand raised.
I do. I'll be quick. One question from October that I'm not hearing an answer to, but I want to bring it up again, had more to do with the meta analysis. I thought maybe Director Belche or somebody might address that the per child spending that occurs under the augmentation creates a larger per child investment than a larger county that isn't getting an augmentation. And equity and just equity and and really thinking hard about, you know, the concentration of children and resources, it leads me to ask this question again, and I apologize. I really appreciate the level of effort on all the other questions, but this is of so much importance that I also want to add on to that the way in which this is a almost, you know, 4.25 year commitment when you're still expressing a need to explore and learn and understand over the course of a year. Makes me wonder if we shouldn't be making a commitment so far out. So the combination of, you know, my equity question coupled with, you know, the exploratory nature of this, the shifts, and whether or not getting ourselves committed for 4 years makes sense. Can you talk about those things?
I can speak to the equity piece, but I would also like to defer to my program advisory members.
I can't see the full screen, so I'm not able to see if anybody else is trying to talk, but I did want to say this, and Chris, we took many of your questions, because you had quite a few questions in October, and I think at that time, me and Molly had similar questions. I will tell you, we've met 3 separate times to dive into this, and equity was at the top of that agenda, because we understand that when you, you know, divide this money out, the per child amount is going to be higher. The conversations that we had around that in terms of us really understanding were lots of examples and evidence of what it might cost a child in Mendocino versus LA County to get to the hospital or get to, you know, or get some of the resources they have, because maybe in LA County, there are multiple service deliverers that can provide that support, whereas in some of these other places they couldn't. And so that really did, with all the examples, I think make us feel a lot more comfortable with that level of equity. I also believe that, you know, one of the things, I don't know, I think I may have pushed very hard was with this type of commitment, we wanted to ensure, I mean, for lack of a better term, there was skin in the game. And so that there was an incentive for these small population counties to take every opportunity to leverage funds, whether it was from shared services or administrative supports and leveraging that. And so I believe that's built into this as well. But the big thing was really around equity. And making sure that once we had determined that, and Debbie, I just want to thank you, because Debbie has done so much research on this, and Molly and I pushed so much, and she went back and got more information. So we really did dig down into it. But once we determined that, you know, the needs of these small county populations were greater and at some level more expensive, I think where we landed last time was that this really is a small amount of money for a large amount of good. In terms of some of the needs of these counties. And while you might say it's not a small amount, when you look at it over time, once we've determined that that's the need and that's the formula, you know, it's not something we'd never necessarily look at for a year or just 2 years, because quite frankly, as we look at the birth rate and we look at other things, I think it was for us easy to project that the issues would continue to remain the same and that this funding support would be able to support those issues. So again, I just wanted to say that we really did dig into this, and they came back with a lot of information and research. Molly, I don't know if you had something to add. We were kind of taking Debbie through the ringer together. You're on mute.
No, you did a great job, Jackie. Thanks.
I'm sorry, Commissioner Perry. Before you jump in, I know that Commissioner Alvarez has had her hand raised for a minute. Can we go to Commissioner Alvarez and then Commissioner Perry?
Thank you. And my comment builds off of Chris after Commissioner Perry's comment. So I had the opportunity to sit down with representatives from in Amador, thanks to the leadership of First Five Association. I'm sure all of us had the opportunity to do that, and it was enlightening to really connect with them and to hear the challenges that small counties have, especially with like just put new challenges on top of theirs, right? As far as distance and geography and fires and just so much. So I really appreciated the time I had with them. But we got into a really interesting conversation about targeted universalism and the leadership of the First Five Commission to actually take that approach for geographic inequities, but recognizing that we also need to do that for racial inequities, and that it's a both and, because like some of the quotes that the leaders were sharing with me, families are rushed and they're stressed, they're disconnected, they can't rely on anybody for an emergency with their child. There are families in LA, in Southeast San Diego, that have the same exact situation despite being in these like resource-rich counties. So trying to think about our responsibility and opportunity, given that we have unallocated funding, do we want to think about taking a racial equity approach as well, in addition to small county augmentation? And I'm not saying we have to do that right now, obviously, but just really considering if we're gonna take these approaches that are absolutely necessary and responsive to the needs of families, can we also explore where our inequities have been for decades and centuries, and that's often with low-income kids of color.
Thank you, Commissioner Alvarez. Go ahead, Commissioner Perry.
Just one final beat on this, which is, you know, if a third of the counties in the state are considered small, and we're adding to that number, either within a 4-year period, it's likely that will grow from 21 to 22 to 23, because the birth rate in the state and in the nation has been dropping for years. So that is something that I don't know that you totally built in yet, but is a consideration. And then finally, you know, for lack of a better term, I mean, small counties are being held harmless in some way. We're making sure they're whole, but the larger counties are experiencing the decline that was brought up during the financial update that is not mitigated by an augmentation. So I just, you know, like these meta sort of, you know, that's a different kind of inequity that I just want to raise. Is like, yes, the micro challenges of running a small county are absolutely real, and they cost more money to run. There's no dispute. But when you look at our colleagues on the other side in so-called larger counties, no one is offering them, you know, the state commission is not offering them an augmentation to keep them whole. And their children could be living in an outlying rural area, even though it's Los Angeles County. So I just really, you know, I want to be supportive, and but I flag these issues because I really hope there's bigger, deeper work on how to make this sustainable, that this is not, you know, we just don't keep retrofitting this idea onto it every time, but we come up with a new way of doing it.
Thank you. I do want to point out something I failed to mention is that by providing this sort of a critical figure, that they are subject to the decline in the tobacco tax with the remainder, the other augmentation. So we're not actually keeping them whole. They're not, I forgot to mention it, but I hear what you're saying, Commissioner Perry. Thank you.
Commissioner Majors.
And I would just love to respond to Commissioner Alvarez. You know me well enough to know I push that card because I'm from LA County. And so I am very clear that while we may be providing additional financial resources for these small counties, some of my African-American kids in LA County that has a ton of resources aren't getting them. We can't solve every problem with every item. And so at some point we have to stop. And again, I hope you acknowledge we took a lot of time to address those issues. I appreciate you elevating them again, but we really did consider those. And I think that's why I sort of commented on that last statement we made, which was after going back and forth and not being able to save the world with this item, we decided that we really felt like, based on the evidence that we had from the small county populations and some of the critical issues that they were having, that again, this was a relatively small investment to make some pretty significant impact. I agree with Commissioner Perry, as I always do when you challenge us to try to handle the California children's problems, you know, as we think about it with each item. And I suggest that we continue to challenge ourselves with that. And how do we look at that equity issue, which you all know is an important piece for me, but how we look at that as we've brought up several times today, which I really appreciate, in the strategic plan. You know, we are, you know, moving a lot of funds and efforts right now to address some critical issues that have come up as a result of COVID and just individual interests. But I think our work, and to whoever made the point, I really appreciate it, really looking at the strategic plan every single commission meeting and saying, where have we gone with it? How are we meeting our issues? Because the strategic plan is what guides us, not sort of this individual sort of breaking down of each item, but what is our guiding force? So I really appreciate all of those points. Let me tell you, we broke it down and got on 3 separate sessions to really come to a good conclusion, I believe.
Yeah, I just want to.
We'll take Commissioner Munger's comment, and then I want to move us forward because we are pretty far behind on the agenda. Go ahead, Commissioner Munger.
Just to support Commissioner Alvarez's suggestion that this is not closing the door on some very creative work that I think all hope we do, all want to do, about all kinds of equity. If you looked at the chart, I was happy to see that you could see on that chart that this little sliver of blue is just, it's a little slice of funding. It's not going to rule out other things we want to do. So this conversation is not over. It's not over. It's just starting. Yeah.
Thank you, Commissioner Munger. And with that, I'd like to call for a motion, see if there is a motion.
I'll move approval.
Is there a second?
I second.
So the motion to approve $20 million from April 1st, 2021 through June 30th, 2025 for the Small Population County Funding Augmentation Program, moved by Commissioner Munger and seconded by Commissioner Hazen. Jamie, do you want to do the roll call?
I'm in charge of muting myself now, and now I really messed it up. So, but I think we want to go for public comment before we take a vote.
Yes, okie dokie. Yes, let us do that. Yeah,
Sorry.
Yes, let's go ahead and take public comment. I see we have 3 public comments, 3 hands raised among attendees.
So we'll start with Angela Glore.
Hi, thank you so much. I particularly want to thank Commissioner Hazan and Commissioner Alvarez, who were part of a site visit, a virtual site visit here in Del Norte County. But I did want to go back, Commissioner Perry, I appreciate so much your insistence on looking at equity because it is a critical issue in anything that your commission does and that our commission does in our county. And I just wanted to give one example of a way that sometimes looking at equity, if we only look at First Five, does a disservice to the children in our state. So for example, one of the First Five California Commission's priorities is early literacy. And in looking at the resources for literacy in a big county versus a county like Del Norte County that has 28,000 people, the resources are so uneven that First Five ends up having to fill in gaps. So in LA County, there are 82 county libraries plus 2 bookmobiles, plus many of the cities within Los Angeles counties also have their own library system. So there are well over 100 libraries in an area that is about 4 times the size of Del Norte County. In Del Norte County, we have one library that is open 6 days a week and one additional branch that is open less than 10 hours a week. And that is the entirety of the library system. The year before I became ED at First Five, I was a regular attendee of the library board meetings, and their budget included $0 for new children's books, 0. And only through significant advocacy were we able to get that changed to $500 for new children's books for the library system. The per capita funding for LA County libraries is 4 times the per capita funding for libraries in Del Norte County. So First Five ends up having to fill a gap that does not exist in other ways, because in other larger counties that have resources outside of the First Five world. So we regularly purchase books for our library because otherwise we purchase their only bilingual board books that they have ever owned in their library system. We have a really low literacy rate for adults here. So we purchased an 80 book collection of wordless picture books for our library, for our adult literacy program. And it's not that those problems don't exist in LA County. I absolutely understand that even with all of those libraries, it does not mean that every child is going to the library regularly or receiving those services. But in Del Norte County, there are some kinds of services that no children get in our county because they are simply not available. We don't have museums, we don't have any of those services, and we have students who graduate high school who have never left our county. Their world is so small here. And if First Five didn't step in those first 5 years, there would be children who never saw anything other than what our county offers, which is astoundingly little in many ways. We have a county where it rains 6 months out of the year, and First Five funds the only indoor play space for 0 to 5 children in the entire county. So I just want to say that sometimes equity is not about equal funding per child. It is about what is the full environment that those children are growing up in, and what other resources does First Five have to replace because they just don't exist otherwise. So thank you all so much for your work. It is a pleasure to see you here today.
Dr. Burke-Harris, would you like me to keep time? Because we're trying to keep it up, would it be helpful?
Yes.
If
Yes,
I kept
please.
time for you? Okay, I'll
Yes.
let you know.
Thank you.
Okay, thanks. Oh,
So in fact, in the interest of I think we're pretty far behind schedule. So in the interest, we're going to limit public comment to 2 minutes as opposed to 3. And Camille, if you could take time and move us forward with our next public comment.
Yes, Peter Barth is up next.
Good afternoon, everyone. My name is Peter Barth, and I'm the Chief of Staff at First Five LA. Kim Belcher, our Executive Director, wanted so badly to be able to deliver public comment herself, and was on earlier, but unfortunately, we also have a Board of Commissioners meeting right now, and so she is where she needs to be. So I will just briefly address a few things. First of all, we at First Five LA want to congratulate and welcome Chair Burke-Harris and Commissioner Jimenez. It's so great to see you. We also want to thank the Commission and Camille and the team at First Five LA at First Five California for the very thoughtful process in considering these issues. And I know Kim was proud to be able to represent the larger counties in this work. A couple of the comments Kim wanted me to share. First is that the network of First Fives has a power and impact beyond its individual parts. And those individual parts, the 58 counties, the association, and First Five California must be strong for a collective impact to be realized for our state's children. And it's in that spirit of that collective impact to realize a just and equitable future for our children that we express our appreciation for First Five California's consideration of continued support for the small population counties, extending a policy that began in 2000 with the founding First Five California Commission, of which Kim was privileged to serve. And I think just very briefly, on behalf of my own perspectives and work with this space, part of the equity issue I think that we acknowledge as the largest First Five Commission is that we know Prop 10 funding cannot meet the needs of all children in California. We need to be looking at additional resources to be able to support their needs. And the reality is that without this small county augmentation, some First Five commissions would cease to exist. And in LA County,
ask you to wrap up. Sorry.
Yes, thanks, Camille. In LA, as our funding has declined significantly, 50% since our founding, we can still fund individual positions who can partner with those county systems. So we really appreciate the consideration to allow these First Fives to continue to exist in these smaller counties so they can do that partnership work. So thank you.
Thank you.
Next up would be Kitty Lopez.
Good afternoon. I'm Kitty Lopez. I'm the Executive Director of First Five San Mateo County, but I'm here today speaking in my role as Vice President of the First Five Association, representing the 58 counties. And because we're limited on time, I think my most important comment would be, other than welcome Chair Burke-Harris and Commissioner Jimenez to the Commission, is to urge you to support the small population county funding augmentation. My colleagues have said it so eloquently, but I will say in a leadership role with the state association, we are in support of all of our colleagues receiving adequate funding to support our young children and their families. Thank you.
Thank you very much, Ms. Lopez. And our final public comment, I believe we have just one more.
Yes, from Nina Machado.
Good afternoon, and thank you for your time. I actually had something all written out and don't feel as though it's the right thing to say right now. I just want to thank everyone for their thoughtful consideration of the topic, all of this hard work. I welcome the new commissioners, look forward to working with you, and I'm going to leave it at that. Thank you.
Thank you very much.
Thank you, Nina. If you're ready to close it out, we can. We still do have two more, but
yes, I think we need to move forward. So let's go ahead and take a roll call.
Okay.
Myra, you're muted. We're going for a roll call vote.
Oh, I didn't even hear her say my name. I'm so sorry. Did they?
I think we might have got muted.
Okay, good.
Sorry.
Sorry, we were muted first. Sorry.
Okay, Myra Alvarez. Nadine Burke-Harris.
Aye.
Monica Fitzgerald.
Aye.
Shayna Hazen.
Aye.
Jackie Majors.
Aye.
Elsa Jimenez.
Aye.
Molly Munger.
Aye.
Motion is passed.
All right, the motion is carried. Thank you very much. Now we'll move forward to the California Smokers Helpline Authorization, item 9. The Smokers Helpline item will provide a description of the helpline, their evidence-based approach to tobacco cessation counseling, successes and challenges reaching pregnant and parenting smokers and caregivers of children 0 to 5, and request funding for continued tobacco cessation services for up to $3.6 million for 3 years, fiscal year 2021 to 2022 through fiscal year 2023 to 2024, to continue tobacco cessation services focused on the First Five California priority population provided by the helpline. I'd like to welcome back Debbie Silverman to present this item. Debbie, I'm going to ask you to limit your comments so that we can curtail our time. I'm hoping that we can, I have 2:48 by my time. So if it's possible for you to conclude your comments by 3 o'clock so that we can make room for discussion and public comment.
Okay, I have very few comments. What I'm going to do is turn it over to basically just to give you some context. You know, we are funding this because we are required to do so by statute. A major health risk to young children is exposure to nicotines, tobacco smoke, and e-cigarette vape, liquid and aerosol. Smoking while pregnant dramatically increases the health risks of preterm birth, low birth rate, birth defects, and damage to a developing baby's brain and lungs. We've been funding this since 2001. What we'd like to do is I'm actually going to turn it over to Dr. Sharon Cummings, who will actually shorten her presentation, I believe, within a very tighten it up a little bit. She's been a clinical psychologist for many years and has worked in the tobacco control industry for 25 years. She oversees the helpline and has been instrumental in developing the protocols that she'll describe to you. So following her presentation, we'll come back again and ask you for that $3.6 million. So Dr. Cummings, if you could, oh, there she is.
Yes. Hi, can you see my notes as well, or just the?
We don't see anything.
Oh, you don't see anything at all. Okay.
But you know, you don't need to go into the history. I think maybe some of the key findings. And
are you seeing it now?
Not yet.
Shoot. Well, I don't know how to do this. Swap presenter. Let's see.
Share screen.
I did share screen. Let's see. Okay.
Is it possible she needs to be enabled by the facilitator to present, to share screen? Sometimes that's required.
Right. In the meantime, I would just.
Here we go.
Oh,
We'll bring it up.
we're bringing it up on our end.
Okay. So
But I would, Dr. Cummins, I'm just going to stress that, you know, go right to the point and.
Can you see it now?
Yes.
Yes.
Thank you.
And we also can see your-
Yes.
And you
There
can
you
see
go.
my notes. Oh, well.
But not anymore.
No, not
Okay,
anymore.
good to
Okay,
go.
good. All right. So thank you. Again, Sharon Cummins. I'm the project director of the California Smokers Helpline, operating out of Morris Cancer Center at UCSD. And I'm going to give you very little about the background, talk more about the First Five support of the helpline, just some of the highlights of the activities, and then plans for our upcoming contract. The whole, you know, I'm not going to go into the whole thing about how we developed, you know, the studies that we've done that determine the efficacy, but know that we've done some very large studies that have proven the efficacy of telephone-based counseling. We were originally funded in 1992 through Prop 99 money to provide free cessation services for the state of California. Like Deb said, the First Five California has supported us since 2001, and it's primarily because of the overlap in our interests, which have to do with the health and consequences to children. What I did want to spend just a little bit more time on is the idea that the helpline really helps deal with disparities, because the health consequences to children from smoking are not evenly distributed across the population. It is very much concentrated in ethnic minorities and in low income, and those people that have ACEs and all sorts of people that already have struggles in their lives, making it harder for them to quit. Those are the ones whose kids are getting highly exposed to secondhand smoke. So our primary work is telephone-based counseling. We're very accessible. We're open 6 days a week. We provide services in 6 different languages. And like I said, the telephone-based counseling is our primary work. The counselors are very well trained. Some of them might have master's degrees, some even PhDs, but they all go through a 60-hour in-service training. And it's really concentrated on things like cultural competence, being able to use the protocol well, how to develop rapport. It has all the counseling interactive things that we need. We're evidence-based because we've done so many large randomized trials, and that's an uncommon thing in our field, that often you get something put out into service and then nobody checks it again, and we do an ongoing check. And then the other thing I want to mention is that we're expanding beyond smoking. We've always done, or for a long time, we've also done smokeless tobacco, but we now also do a lot with e-cigarettes or vapes. We've also expanded beyond telephone counseling to provide other kinds of services that are not telephone based, as people use the phone differently these days. A couple things that make the helpline such a good model. Accessibility is primary. You don't have childcare, transportation issues. You can phone people. It's flexible scheduling that allows you to really interact with people when their motivation is highest, instead of saying, well, yeah, we have a group starting in 2 weeks. Check back with us and come in 2 weeks. And the other very important component is that it's proactive. Once somebody makes any effort to reach out to us, we take the responsibility to make calls to them so that their flagging motivation doesn't get in the way of ending their quit attempt. The other thing that makes it a really good model is that it has very broad appeal. Clinic-based programs typically have high levels of white middle-class people, and the helpline has a tremendous number of low-income and ethnic and gender minorities. The fact that things are individualized is always a plus, and then we do ongoing assessment and monitor the success by doing a random sampling of people. We also have, with First Five support, came up with a specialized protocol for pregnant women. And I'm not going to go into the study design and description, but the idea is that we've taken kind of a regular telephone counseling program, thought about the things that make it different for pregnant smokers to quit. So for example, deprivation mentality. If you've ever been pregnant, you know it's like you have to give up everything in the world. And we get a lot of people calling and saying, look, I've already given up drugs, I've given up alcohol, I've given up my medications, I've even given up coffee. You can't expect me to give up cigarettes. So it takes a different kind of skill. And that protocol that was really supported by First Five has gone into integration into the helpline services and is now available for use for everybody. I just wanted to give 2 slides on demographics and point to a couple of things. So these are the First Five California helpline clients over these years. And they're younger. They're median age is 38, which is younger than a regular helpline caller. And that's primarily because they're young, they're parents of young children. They're more likely to be female. That's not surprising. But I wanted to focus on the fact that 74% have Medi-Cal. So they're low-income people, and another 11% are uninsured. So almost everybody is of low income. Also wanted to show that in terms of ethnicity, only about 40% of our clients are white, and the rest identify as other than white. We have high proportions of African Americans, which is great, and a lot of multi-ethnic. The other one I wanted to mention is that the more nicotine a person ingests in a given day, the more addicted they are and the harder it is for them to quit. So this just compares the First Five helpline clients to smokers in general in California. So the helpline callers, the First Five helpline callers, are much more likely to smoke daily. And that little graph with the arrow shows that about over 40% of them are a pack-a-day smokers. And that's a fairly heavy smoker compared to smokers in general. Some of the highlights of the First Five California activities that we've done: we do the individualized counseling, which I already mentioned. We provide quit kits that have, self-help materials and a My Plan that they work on with their counselor, or they can do by themselves. We give 2 weeks of a transition kit of nicotine patches. We provide help for people that are vaping, and I'm going to talk about that in a second. And also we do training and outreach to people who work with First Five target populations. So in terms of the vaping, this was another one that was really supported by First Five California. They were very interested in the whole e-cigarette vaping issue and how it affected children, and the vaping aerosol and how that affects children's health. So we started with doing our research and then coming up with fact sheets that are relevant to the population. We developed a separate protocol for vapors, and again, support from First Five was instrumental in that. And again, what we did was we took our standard protocol, but then we looked at what made vaping different, and what differences might lead to differences in how they quit and stay quit. So for example, people who vape tend to keep their vape with them all the time, and they just take hits off of it whenever they want. And it's very different than smoking, where you go out for a smoke and you spend a certain number of minutes with your cigarette, and then you don't have another cigarette for a certain number of hours. The result of that is that the planning is quite different when you get into trying to figure out what was the trigger, what triggered me to pick it up, this 120 times that day. It's much harder to come up with a really good plan, but our counselors are trained in doing that. It's been developed, and now it's fully integrated into our workflow. So it's not just used with First Five population, but with anybody who vapes and wants to quit. We've also done quite a bit of work with healthcare provider training. Some of the early work was done with CEASE, which is really their job was to train pediatricians to intervene with parents and caregivers in a medical setting, like these were the UC, 4 UC medical centers, and intervene with the parents and get them referred over to the helpline, where we could then call them and get them participating in cessation work. We also, I'm sorry.
I'm just going to stop you and let you know it's 3 o'clock, and Dr. Burke-Harris had kind of set that as a parameter. So if we want to quickly go to what it is you're going to do,
yes.
with this, that might be good. Thank you.
All right. So all I'm going to say is that we do work where we reach out to other organizations and people can refer to us, and we work with those organizations to get them familiar with us. We also do reach out directly to consumers. So we can do target. It's especially effective to do targeting of parents and of young children, and also pregnant women. Facebook has been quite successful. And then we're trying to do a lot of other things to really strengthen our connections with the California County Commissions, just using a more intentional approach, getting into the kit for new parents, trying to make sure we're featured prominently on websites, et cetera. Okay, so I'm to the new contract. I just have 2 slides. So this is the last major one. What we're trying to do is maintain our effective services, do the telephone counseling, including pregnancy-specific protocol, continue providing the nicotine patch transitional kit. And then we want to expand our services to the population by building on what CDPH has already invested in, things like our texting program. So we have a texting program for smoking and one for vaping, and nothing that's sort of customized to the First Five population. So one of the things we're going to do is we're going to look at for opportunities within those existing programs to identify people as part of the First Five population so that we can give them targeted information. And then the last thing is we want to continue doing a kind of and expanding a sustained and very intentional outreach approach. It's very hard to keep sustainability on that, but we're going to give it our best shot. And that's it. So I talked very fast, I'm sorry, but if you have any questions, I'm open.
It's much appreciated. Thank you so much.
No
I know, Debbie, you had a couple slides on the funding. I'm going to ask you just one slide to say where the money's coming from, please.
Oh, I have to stop sharing. There we go.
Okay, so very quickly, oops, wrong slide. Let's see. So this is you see my slides, but I'm just going to show this to you very quickly. Smokers Helpline projection. You see that we are going to be asking you, we are going to be taking the funds, again, formerly 100% of the funds came from unallocated. Moving forward, we would like to have 40% from education, 10% from the research and development, and 50% from unallocated. Here you see what those fund balances would look like by the end of 23-24 in each of those accounts. You mentioned earlier that SPCFA was just a blip on the radar when it take a look at the, how it affects those funds. Well, here you see this is an even lesser of a blip because it's much less funding annually that we were looking to take from those accounts. So the request that we are looking for is $3.6 million over 3 years, beginning July 1st, 2021 through June 30th, 2024.
Thank you, Debbie.
Thank
Dr.
you.
Burke-Harris, yes.
Sure, yes. Debbie, do you mind ending your screen share so that I can see?
Absolutely.
We have, so I can see our participants. Do we have questions and comments from the panel, from the commission? Hearing none. Oh,
you do have 2 public comment.
yes, I see that. Thank you.
Okay.
So do we have a motion to authorize $3.6 million from July 1st, 2021 through June 2024 to continue tobacco cessation services focused on this First 5 California priority population provided by the helpline?
Anyone? Is there not a motion?
Yes, I make the motion.
Moved by Commissioner Hazen. Do we have a second?
I'll second.
Seconded by Commissioner Alvarez. We'll take public comment at this time.
We have April Rossler.
Hi, this is April Raisler. I'm the branch chief for the California Tobacco Control Program, and I want to thank you for the opportunity to speak. The Tobacco Control Program does request your continued support of the California Smokers Helpline. Motivating and supporting people through their quit journey is a really big and complex job, which is really complicated by an industry that is aggressively marketing its products to disadvantaged communities and is aggressively, trying to disrupt both local and state tobacco prevention and reduction efforts. The California Tobacco Control Program really appreciates the support that First 5 has provided to the helpline over these years. And I just feel like now is more important than ever to continue to invest in helping people to quit. With the EVALI epidemic followed by the COVID-19 epidemic, lung health has really risen to the forefront. And our surveillance work at the Tobacco Control Program shows that communicating to people about lung health and the association between COVID-19 and vaping and tobacco use is motivating people to quit smoking. So we need to really continue to invest in this effort. The California Smokers Helpline is, like a premier quit line in the United States and globally. They've pivoted really quickly to move from just telephone-based services to really adapt to their target audiences of using chat, texting, mobile apps, Alexa. We're working with them on a video cessation intervention. They pivoted really quickly to address COVID-19 and the relationship with smoking and vaping. And, they stood up. Yes.
Your time is done. I don't
Thank
want
you.
to. So if you could close, thank you. Sorry about that. Next, Jim.
Next is Elisa Tong.
Yes.
Hi, my name's Eliza Tong. I'm an associate professor of internal medicine at UC Davis, where we're all really proud of Dr. Burke Harris, being an alumnus of our med school. As a physician researcher, I've worked for over 20 years in tobacco control policy and cessation, over half with the Helpline, and currently I'm the project director for California Quits, which is a project for health systems change on tobacco treatment funded by the California Tobacco Control Program, and we work with California Department of Healthcare Services. But quickly, 2 points I'd just like to make in support of the Helpline and the significance of renewing the Helpline's contract. One, the Helpline works really hard on outreach to First Fives population, and they're great collaborators. And together with my project, California Quits, we're working together to develop stronger ties with the safety net health system providers, the Medi-Cal managed care plans, public health partners, maternal, child, adolescent health partners and services. Specifically, it's the hard work of integrating the Helpline as a free evidence-based counseling resource for referrals into people's workflows. And we're also super excited to build more bridges with the ACEs Aware grantees about the Helpline as an evidence-based referral resource. We know that's super important too. And then second, First Five funding of these free nicotine patches is really important to incentivize the First Five population's access and utilization of treatment. So, for example, as Dr. Burke Harris probably knows, pediatricians see kids 8 times in the first couple years of life, and they might see a kid exposed to secondhand smoke, but the pediatricians might not feel comfortable prescribing those medications, but they can make the referral for Helpline to the Helpline for services. And then, as April noted, these free nicotine patches, which are mailed directly to callers' homes, have been a huge benefit during this COVID pandemic, when we know folks are not going to in-person services from clinics to WIC. And we know that smoking doubles the risk of getting sicker or dying with COVID. So in summary, just want to throw out my strong support that the Helpline's a critical resource for First Five and all of California. And I hope that we may continue engaging in further dialogue about how the Helpline, California Quits, the broader tobacco control partners can work together with First Five.
Thank you very much. Thank you for your partnership and your excellent work.
That's the end of our public comment.
Okay, thank you, Camille. And with that, Jamie, if you'll take a roll call on the motion at hand.
Myra Alvarez.
Aye.
Nadine Burke Harris.
Aye.
Monica Fitzgerald.
Aye.
Shanna Hazen.
Aye.
Jackie Majors. Absent. Elsa Jimenez.
Aye.
Molly Munger.
Aye.
Thank you. Motion carries.
Motion carried. Commissioner Majors is transferring to her car, so we're getting her the right code. She'll be back on shortly.
Okay. And now we'll hear an update from First Five California staff on the following information items. No action will be taken by the commission. And first, we'll hear an update on the home visiting workforce study. And for this item, Child Trends will present findings from the home visiting workforce study and demonstrate a new supply and demand mapping tool designed to assist state and local home visiting agencies improve coordinated service delivery. And right now is 3:12, and I think that if we can complete this item by 3:35, that would be great.
So it's me again. Thank you very much. It's a very busy day. So just really quickly, yes, Child Trends is just recently completed a significant piece of their contract, which is a statewide survey of the home visiting workforce, which will soon be published, and we'll send you a copy. These findings will be of great interest to policymakers and our sister state agencies as we strive to develop an infrastructure to support a qualified and stable home visiting workforce. I'm pleased to introduce Danielle Hegseth from Child Trends, a researcher and the project manager, who actually has shortened her presentation for you today, but look forward to more in the future. Danielle, take it away.
Where is she? Okay, there she is.
There we go. Hello, everybody. Can everyone hear me okay?
Yes, we can. Hi, Danielle.
Hello. All right, I will share my screen so we can get started. All right, thank you all so much for having us today. I'm joined by a number of my team members on this call as well, who will hopefully be available to answer some questions if there are any after my presentation. As Debbie mentioned, I'm going to kind of breeze through this and focus on what we think are some key findings and implications for you all today. And I'm happy to answer any questions you might have. So I won't go into detail about the study goal. Debbie mentioned that already. I would like to just note for you all, especially for any commissioners who didn't hear from our team a few months ago, that our work is informed by a core advisory group. This is to ensure that our work is meaningful for the state of California and guided by thought leaders who can provide guidance and ensure any products we develop are also effective and appropriate for the state's needs. A list of members of that group is available in the slides that were posted. And we've also consulted with a number of other advisors ad hoc as we've gone along, including several members of this commission. So we really thank everybody's support across the state so far since we began this work back in April. All right, so this first part of the study, or I'm sorry, presentation, will be findings from a survey we conducted with home visiting staff across the entire state of California. One important thing to know is who we heard from. We heard from over 900 home visiting staff representing 48 counties and 54 different home visiting models. As a part of our analysis, which will be available in a full public report of this survey that'll be out later in February, we did some sub-analyses by regions as defined by the Public Policy Institute of California. And we just wanted to note here that we did receive responses representing all of those regions, and our report will present findings broken down by regions in addition to some other subgroups. So we had a wonderful response. I would like to note this survey was administered in the middle of the pandemic last summer into the fall fires across the state of California, and we just had such wonderful response across all home visiting staff and agency partners. All right, so some important findings we want to present to you today are the characteristics. Who is the workforce, the home visiting workforce in California? So something important for us to, that we learned to tell you is that a majority of home visiting staff do identify as being of Hispanic, Latinx, or Spanish origin. And these demographics also do mirror the families on their caseloads. Almost all of the home visitors reported that at least half of their families also identified as Hispanic or Latinx. A majority of home visitors also reported speaking Spanish fluently. So that was another aspect. And this percentage of Latinx and Hispanic origin of home visiting staff is much different and higher than the findings in other national studies of home visiting workforce. Another important characteristic of the workforce in California is that while the workforce is experienced with working with parents and families, they're pretty new to the field of home visiting specifically. So as you can see here in this blue box for home visitors, 40%, a little more than 40% have been in the field of home visiting for less than 3 years. So that's pretty new, and that's a big chunk of staff. So that's something important to know as well. These staff come from a wide range of educational backgrounds. This will be important as we move into the next phase of our work, which does look at workforce recruitment, training, and retention. So it was important for us to learn, how do these staff get into the field of home visiting in California? What types of degrees do they have? Here you can see the most common degrees that were reported in our survey, but there were a range of others as well that aren't listed here, in addition to various certificates. The other really important finding and focus of this survey was the mental health and well-being of the workforce. So as you can see here, the mental health of the home visiting workforce in California is of concern. 1/4 reported depressive symptom score at 8 or above. This is also higher than other national studies of the workforce that have been conducted recently. In addition, they reported a number of different stressors, of course, related to COVID-19, including being worried about contacting it, and then the loss of social connection and social isolation that has been a huge part of the pandemic, along with increased anxiety or depression. So reporting actual depression symptoms is measured by a depression scale, as well as just general increased anxiety. So the workforce is under quite a lot of stress. I'm going to skip ahead to a couple of this item of factors for retention. So in looking at the health and well-being of the workforce, we also wanted to learn what types of supports are going to help them stay in the workforce. And these factors listed here are, we enter them into exploratory models, and we learned that these are going to actually help support whether or not a home visitor is going to stay in their position for at least one more year. So we've broken these factors into two different categories: programmatic supports and home visitor characteristics. For programmatic supports, having a say in their program decisions was something that would support retention. Receiving training on implementing virtual home visiting is something that, of course, rose to the top across this study so far, given the fact that the pandemic is going on and most home visitors in California are conducting home visits virtually. In terms of characteristics that support retention, having more than 3 or more years of experience in home visiting is an important factor. That's especially important in the context of who the home visiting workforce is in California, since we know that about 40% of them are new. Did not experience discrimination in the workplace. So there were a small percentage of home visitors that did report they've received discrimination in the workplace, and we put this into the model, and so not experiencing that was a factor for retention. And then being satisfied with the amount of on-the-job stress and salary. These are all things that would support people staying in the workforce longer, which we've also found in our study that wasn't presented here, that staying in the workforce longer also has important benefits for the well-being of the workforce. So I'm going to walk through some of the implications of these findings, and some will speak to some findings we didn't look at, but that I can talk through further if there are questions. So the big question we wanted to look at with this survey was, how can we strengthen the workforce and support retention? I mentioned our next steps are going to be learning more about the pipeline of the home visiting workforce, how they get into the field, and how they can be further trained. So implications from these findings include to strengthen and support retention, addressing the diversity of workforce educational backgrounds and their training needs will be really important. As we saw, they come from a variety of degree programs. And so we want to really think carefully about how we can train this workforce in a way that's cohesive, knowing that there are different nuances needed depending on the home visiting model. Another implication is that increasing supports for home visitors that will reduce their depressive symptoms and on-the-job stress and experience of discrimination is really important for supporting retention. Creating opportunities for home visitors to feel more empowered in their programmatic decisions is an important consideration, as well as ensuring home visiting programs have supports in place for families' cultural needs, including any ways that programs can collect and provide data about the communities in which programs are operating, so staff can know at least things like what languages are spoken in the community. While a large portion of the home visiting workforce does speak Spanish fluently, we did learn that these home visiting programs across the state are serving families that speak a range of languages. All right, so I'm just going to go a little bit about future data collection that we plan to do in case some of you are wondering what's next. Additional research will be conducted in the coming months, the spring and summer, to further examine how the workforce in California, as I mentioned, is recruited, trained, and supported long-term. Understand their perceived needs, barriers, and challenges related to staff obtaining mental health supports. One of the findings I didn't walk through today was that staff do feel well supported by their supervisors, even in the midst of having high numbers of depressive symptoms and experiencing stress. They have a they're relatively satisfied still with their job. They feel connections to their coworkers. They feel like their support of families is meaningful work. Those were almost all home visitors reported that. So we think that's a great strength, but also, even though many of the home visiting workforce receives benefits like health insurance, they were about half of them are requesting additional mental health supports. And we want to explore this even beyond just things like reflective supervision, which we did also ask about in the survey, and really dig deeper on what other types of concrete mental health supports would help ensure a strengthened and resilient workforce. Future data collection will also determine whether and how staff would like to receive more mindfulness training. So something, again, digging a little more specifically into mental health supports, whether it benefits their work and well-being. So one of the findings you'll be able to read about in our full report is some of the exploratory analyses we've done around how mindfulness can support retention. And finally, we are planning to include families in our future data collection. We really want to gain their perspectives on the qualities and skills of home visitors in order, the things that help ensure their families' needs are being met. Additional support from home visitors they aren't currently receiving. Their perspectives on alignment and goals, communication with home visitors, and then any opportunities for raising family voice in policy and programmatic decisions. So not just home visitors' voice in those decisions, but family voice as well. So that's a very quick overview of many of our findings from the full workforce survey. I'm going to transition now to the supply and demand mapping tool. I know that I have about 10 minutes, so I'm going to try and honor that time. This won't be a live demonstration. I'm going to try and go through some screenshots of the mapping tool. We're still finalizing. Oh, yes, go ahead.
335, I realized that included comments.
Oh, absolutely. Then I'm just going to say a couple quick things and then I can wrap it up. We are doing what we're calling a soft launch of this mapping tool on Monday. We're going to be presenting it to the home visiting coordination grantees. They're gonna be able to see in great detail the type of data that's in this map, how they can use it to hopefully support their coordination grantee work, including being able to export data profiles on their county. So I'll just really quickly say that we are hoping this tool can be used to inform home visiting policy and programmatic decisions. We believe it'll help support alignment of available resources even beyond home visiting. As part of our data collection in the survey, we collected information on the home visiting funding slots, the characteristics of families served, and all those other things kind of related to home visiting programs. But we also inputted a lot of demand data related to a wide range of family characteristics and potential risk factors. And we did include things like race, ethnicity, languages spoken, a lot of maternal child health indicators and things like that. So we're hoping this map will be really informative beyond just home visiting, although that's what its current focus is. So we also hope it can be used by a wide range of audiences, and we plan to have it launched more widely later in February, but we do anticipate those coordination grantees will be able to start using the data in this map right away.
Thank you.
Yes.
Do we have questions or comments from commissioners? Commissioner Fitzgerald?
I'll look at the real screen. Sorry, I have a bigger screen over here that I'm reading because my eyes are bad. Thank you so much for this research. This is such important work, and I really appreciated learning from Debbie being on that subcommittee and everything. I have a question regarding, I mean, obviously the training is really important, and I know, especially regarding the mindfulness and mental health, but especially in terms of the next phase of research around the qualities and skills that when you're doing families. I'm wondering how, what kind of training for the home visitors, and then two parts, what part of training for the home visitors, and then also when we follow up with families, can we include issues around cultural humility and diversity, equity, inclusion training that the home visitors might need or have, right? So that's two parts. There's one, training for the home visitors, and also then two, how can we in the survey to families kind of interrogate ideas of cultural humility and equity for those families and their experience with home visitors. Does that make sense? Sorry.
Yeah, yes, absolutely. So for the latter part of that question, we definitely want to explore that with families to the extent possible. Right now, we're planning to do focus groups with families to learn kind of the range of ways that home visitors can better meet their needs, and that would definitely be a part of that conversation. In terms of training, we are planning to explore both the kind of modalities of training that would be most useful, as well as whether it's happening in service versus before you even get to the job. And Sarah Crown is leading the workforce survey and that finding. And so do you want to add anything, Sarah?
I was just going to add that we did ask about whether home visitors had received training in cultural sensitivity, implicit bias, and racial justice and equity, and the majority have, but at the same time, the majority have also asked that they'd like more training in those areas. So I was just going to add that piece.
Oh, yes, thanks.
Well, and I thank you. And I know a lot of the really good sort of stuff around mindfulness now, and that's all embedded in it too. So it doesn't necessarily have to be a separate thing, but thank you. Thank you.
Yeah.
And I had seen that Commissioner Munger, it looked like she had raised her actual hand, and Commissioner Jimenez raised her virtual hand. But I think Commissioner Munger was first.
Oh. I didn't mean to make you think I had something to say. And I'm sorry it took me so long to unmute to tell you that. I'm fine.
Commissioner Jimenez.
I'll be very brief. I just want to thank Danielle for the presentation. I believe that home visiting is a strategy that we need to be implementing across California, particularly for our most vulnerable, higher risk mothers. Again, making sure that our children start off the right way from the beginning. And I do look forward to maybe in the future receiving another presentation, particularly as the mapping tool is implemented, to see what we can learn from what's happening at the ground level and see how we can help ensure that this strategy is implemented in a way that truly does help us achieve the goal of having our children and families thrive.
Yes, thank you. We would be happy to come back anytime and present more information. We won't have a shortage of it.
And I have just a very quick question before we move to public comment, and that is looking at the rates of depression or mental health concerns among home visitors. I was wondering, to the extent whether we tracked or not, whether home visitors are being trained on preventing vicarious traumatization and burnout, and yeah.
Yes, that I think we asked about. I don't think we used a burnout scale, Sarah, in our survey, did we?
No, we did not do that, a burnout scale, but we do have some questions just about whether or not staff, just broadly, if some of the reasons that they're leaving home visiting field is related to burnout, and we are seeing a little bit of that from some of our supervisors who were able to report on staff reasons for leaving.
Although that is something, since the next phase of this work really focuses on how to strengthen and retain that workforce, we'll be diving into things like burnout and other reasons people leave the field for sure. We've had discussions with Debbie about that already.
Yeah, that's just something I would want to highlight, that we've certainly learned from our ACEs Aware work, recognizing home visitors as an important part of the network of care, that one of the key ingredients is that training about preventing vicarious traumatization, especially now as we see that rates of ACEs are increasing due to the pandemic. Just making sure our workforce knows how to, has the tools to be able to prevent that.
Yeah, yes.
And with that, in terms of public comment, I don't see any hands raised. Camille, is there any public comment on this?
Nope.
Okay.
No public comment.
Wonderful. Well, and then with that, we can move forward to get an update on the master plan for early learning and care. The Early Childhood Action Research Team will present an overview of the final version of the master plan to the commission, and I will turn it over to fellow committee member Chris Perry for some opening remarks.
Thank you, Chair. And here I am in another role in my day job. giving you a very quick overview of what we accomplished through the Master Plan for Early Learning and Care, which was completed on December 1st of last year. It's already been 2 months since its completion. I'm joined today by colleagues at WestEd, Lupita Alcala and Janelle Kubanik, who are going to essentially race through the Master Plan on Early Learning and Care, thinking that possibly most of you have had some exposure to it since we released it in December. But I want to back up a minute and just give you some bigger sort of situational awareness and context for this plan so that we can kind of hopefully incorporate it into our thinking here at First Five California. And in fact, you've already started to help us implement recommendations within the Master Plan for Early Learning and Care. When Governor Newsom ran for governor, he ran primarily on an early childhood platform. When he took office, he brought with him a chief of staff who had a strong commitment to improving the approach to early childhood funding and investment. And when she looked for a roadmap, couldn't really find one. There were multiple research documents as recently as the Assembly Blue Ribbon Commission that were very useful, but the administration didn't have its own essentially operating instructions for how it might prioritize future investments in the system to create greater racial equity and better outcomes for kids. So we spent the better part of 2019 researching 5 key areas, which resulted in 4 goal areas, which resulted in more than 17 recommendations. We're going to share those with you in a minute, but I'm really happy to say that at the same time the master plan was being developed, our Surgeon General was busy completing her seminal report, Roadmap to Resilience, more than 400 pages of recommendations, including some child development recommendations. My colleague Kim McCoy-Wade at the Department of Aging has completed the master plan on aging. There are significant efforts being made to look at our system overall and look at Californians more holistically. And so that brings us to early childhood and how this fits into the larger spectrum of planning that goes on within the administration and across the state. As I mentioned, you've already begun to help us in implementing portions of this. Shared services already covered today extensively within the small county augmentation item. The dual language learner knowledge accumulated and shared by the commission has been immensely helpful. And finally, your work on providing supplies during the beginning of the pandemic also helped us while we were planning to feel less upset and scared that there were services not necessarily reaching families while we were planning. There's a great tension between near and long-term work. And by you taking on that near-term opportunity, you allowed us to continue our work on long-term strategy. With that, I will turn it over to Lupita and let you take a look at the vision of our Secretary, Mark Ghaly, on the next slide while we move into the details of the plan. Lupita?
And I'm going to just jump in before Lupita begins and just let folks know that we're going to table the last item on the agenda about the California Family Book Distribution Partnership. And so this agenda item will take us to the close of the meeting. I just wanted to, I forgot to announce that before you were saying.
Yes. Oh, let me keep going. No, just kidding. But I did want to say that the secretary, who I don't know about all of you, but I strongly encourage you, follow him on social media, attend his weekly press conferences. He is a tremendous visionary leader in our state. He's been a tremendous partner to the Surgeon General and to me in looking at how we might really unlock the innovative spirit of California through early childhood investments. And how do we begin the greater integration in our society with the youngest members of our state as a way to ensure that we're reaching everybody's reaching their potential. So really excited to share his vision with all of you and represent him on the commission. And with that, send it back to Lupita.
Great, thank you, Chris, and Chair Dr. Burke-Harris, Vice Chair Munger, Commissioners, and of course, Executive Director Maben. It's a great pleasure to see you all. We have a lot of slides. We have more slides than we're actually going to present today, but you'll have it available to you at your leisure to look through all the details. But we'll highlight the parts that we think are most relevant to First Five California and the local First Fives. This particular slide, you know, as Chris Perry mentioned, that this work began before a pandemic was even sort of felt or envisioned or even we knew about. And so throughout the process, we've always known the early learning and care system was truly fragile, but obviously it was exacerbated by COVID-19 and, you know, the sheer number of family child care centers and homes that had a temporary close and permanent close as a result. So while we were developing this plan, we were thinking about how to redesign and build a stronger infrastructure, sustain anything that may come our way in the next 10, 20, 30 years. And so we're particularly proud of a lot of the different recommendations and of course our 2030 plan that's listed here. These goals mirror the recommendations made by the Assembly Blue Ribbon Commission, the Lifting Children Out of Poverty Task Force, the Rate Reform Work Group, the California's Transforming the Workforce for Children, and input, of course, from families, providers, advocates, community groups, and researchers, a lot of which was done via Zoom and online because of what was happening in the pandemic. But we want to really just provide a big overview. What we want is what everyone's always wanted, to provide comprehensive early learning and care for infants and toddlers. We want to ensure that all families can easily identify, access, and choose the care that meets their needs. And we want to promote school readiness through universal preschool for 4 and 3-year-olds that need it. And then, of course, you can't do any of this without a strong, viable workforce. And so we want to build a high quality workforce, and we want to compensate them appropriately. The next couple of slides, when you have a chance, I would love for you to look at the videos and quotes that are included on the website. But if you can, Janelle, move us to slide 6, we can talk a little bit about the interactive site. When you have a chance, and I'm hoping you do, you will go to our early master plan for early learning and care site. And I'm hoping someone in a chat can put in the web link. And what we have here really is we've already had a resounding interest, and we've had over 5,000 unique visitors, over 20,000 page views. You can download the master plan here. You can download a summary in Spanish or English, and the entire site is in both Spanish and English. Next slide. These are the goals and solution pages, and the solution pages really include promoting practices that ensure equitable early learning for all young children, supporting families as their child's best advocates and teachers, ensuring those who need services the most get them, bring equity to the workforce, and of course using data to bring equity to the forefront. So we've taken what's in the actual master plan and put it on a website in interactive fashion, where you can view not only the solution, the goals and strategies and solutions. For instance, in the very next slide, you'll see how we take every solution page and we solution, and then we have a description of the major components, including specific strategies that are employed in each solution page. So that's what's really neat and interesting. And every page gets you to the right strategies and solutions. The very next slide, there's also, if you navigate on the home page under, you can see strategies and resources, and it'll take you to each of the programs, workforce, funding, and administration. If you, up on the top, on the next slide, you'll see resources button. And the resources button, we were able to do a number of briefs from shared service network, dual language learners, universal preschool programs, as well as facilities and data. So you'll see a lot of what was informed in the master plan was not only families and stakeholders like many of you, but through the actual research that was done. And then finally, slide 11, you'll see just a version of the entire site and how you can get to it easily. Okay, we're on slide 12, trying to get to the meat of it. And Janelle Kubanik has joined me as well, and she's helping me with presenting the slides, but also will be interjecting. The entire plan is made up of 4 goals that the Deputy Secretary Chris Perry mentioned. It really outlines programs and what we want to see in programs. The goal 1 is to unify and strengthen programs and services to children. And this means streamlining the system to simplify funding and administration
and improve a family's experience. So the system work requires including collapsing numerous program requirements, ensuring that high quality continues. For preschool expansion, transitions between birth to 3 and through preschool, both for 3-year-olds and 4-year-olds, including services for children with disabilities, ensuring that our providers, all providers, and we'll talk more about that in the workforce, have information, data, professional development, and not only serving children with disabilities, but children that are dual language learners and children experiencing trauma, as well as children that need additional support. And I'm ensuring that in the unifying strengthening programs that we provide before and after school care, we know that parents and families need additional, and we know that good programs are longer than 4-hour programs. So goal 1 is really focused around unifying standards and programs. And we know that First 5 has always supported and advocated for comprehensive whole child supports, school readiness, through including ensuring dual language learners are served through the different, not only research and pilots that you've funded. In addition, we know that in the workforce section for goal 2, First 5 has supported high quality care through the QCC program, the registry, through data, and of course, professional development and coaching. The quality standards and pathways, COVID, obviously, we've talked, has shown the fragile workforce, how fragile the workforce is. And so what I've talked about earlier is as we rebuild and grow the workforce to meet the need of high quality care, that will require that we have pathways in the careers that include, but are not limited to offering through higher education. But we heard loud and clear from providers, you need to meet us where we are. We need it to be community-based, trusted providers, culturally and linguistically appropriate for us. And you need to start us where we are, like meet us where we are. We are not all already on the higher ed track. So you need to start us where we are. And any professional development that you provide needs to be count towards something. They want to make sure it counts towards something. So that is our challenge. And ensuring that these standards, of course, include all the facets that we talked about, you know, the diversity of the population of the children and families we serve. So that is children with disabilities, that is dual language learners, children experiencing trauma, and ensuring that we provide students and children those supports. And that will include aligning and streamlining Title 22 and Title 5 to ensure that consistency. And of course, we've talked about the pathways. They need to be culturally and linguistically appropriate, and we need to meet providers where they are. And reimbursement rates, obviously, many stakeholders, providers, families talked about how underfunded the system is and how you don't ask us for one more thing and not reimburse us for what we're currently doing, plus what you're asking us to know and be able to do. So we absolutely heard that. And so in the plan, you'll see a structure, a formula for how a reimbursement formula would look like. And you'll see that more detailed in the additional ones, in the additional slides. But what we know is that you need a decent rate. You need to ensure, you need to account for the region, where the region and the market in that area. You need to account for quality, and you need to account for the characteristics of the children you're serving. You may need additional supports and resources for children with disabilities or children experiencing trauma or dual language learners. And so that formula accounts for that as well. And lastly, the four-legged stool here is that we have to have a strong structure. First 5, of course, have supported data systems through QCC and registry and shared service networks just recently as well. And local First 5s play an actual huge role in that regionalization. So many of these infrastructure supports, yes, the state can provide some infrastructure support through data integration, through Health and Human Service, with Department of Social Services, with the Department of Education, and that needs to happen. And not only that, to CTC and even First 5 information sharing, right? But there's a lot that can happen regionally. And so What's in this bucket really is about streamlining eligibility through data systems. So if a family is already eligible for CalFresh, they would be eligible for childcare. Just for income eligibility, obviously you need to have there are other requirements. We also make sure that if we share this a need for facilities, we know that a lot of facility improvements and expansion and redesigning needs to occur, particularly through, we heard loud and clear, the quality improvement system. Yes, the state has a role, but so do local QCCs and what you can do to share data and streamline. Shared service networks is something that was obviously, First Five heard a lot about that today, but we heard loud and clear that it's something that small family childcare homes and family friend and neighbors and small centers need support with business, but also professional development, facilities, substitutes, and mentorship and apprenticeships. And so there's quite a bit of recommendation there for that as well. Janelle, do you want to add anything to the reimbursement or workforce pathways that I didn't hit on yet?
I think one thing I'll just say about all of this that includes workforce and reimbursement is they're intertwined, right? That is, we don't change the system by part, we change the system by parts together. And I think that's something that First Five really has recognized as you've looked at what's the work of transforming and supporting young children and their families. It's not just dealing with health or school readiness or books. It's actually the interplay that gets us to the system. So we feel like it's hugely important that if we're going to be changing the system, yes, we have to have funding that elevates what is there in resources, but it needs to support the very things we say inform quality and access. So let's get our money to the things that we say matter in terms of outcomes and outputs of the system. And I think that's what you're seeing in these 4 goals is you can't just do one and expect that one thing to get better without realizing and recognizing it's the 3 of them that take level steps together. So let's do more to set the standards and let's do more to prepare people for them. And then let's do more with that to fund it. And as you can do more, you can do the next step of doing more. So I think that one of the reasons we see this as a 10-year long-term plan is because it can't be done in one leap. It's going to be done in several bounds. And so I think looking for organizations like First Five that have a notion of what it means to sustain, what it means to distribute is going to be essential if we're going to keep up the I'll say building and sustaining of momentum to achieve the broad goals that the PETA started with.
Janelle, do you want to jump to 17? The slides 13 through 16 are just more detail of each of the goal areas that when you have a chance. So maybe we can go to slide 17 since it's 3:50 and I know you end at 4 and there needs to be time for some discussion and then public comment.
Okay, so here's the bottom line is, right now, let me just give you some context. What part of this work was doing a cost analysis or a review of creating the cost model. And so underlining that is, well, how much do we spend right now? And all told, if you look at current spending, we have about $6 billion that's coming in through the fees, the contributions that families make to the system. And this includes those that are, at all income levels. So that's about $6 billion that families are paying for everything from childcare to preschool to nanny services, et cetera. There's another $6 billion or so, including contributions from First Fives, but also federal funds, state funds, local funds that are coming in. And collectively, if you look at the system, we're spending about $12 billion. So when we looked at the analysis of what would it cost to fully attend or start, think about the transformations described in the master plan, we came up with a broad estimate, because it depends on what policy choices are made, of somewhere between an additional $2 to $12 billion. So what $2 billion gets you is it gets you some of that incremental change. Doesn't really dramatically expand access. It doesn't really dramatically change what we're saying from our workforce, but it does get us to some of the areas that we've said we need to, which is providing some of the access for all those that are income eligible to have services. Now, when we get to the 12 billion, that's when we start to say, well, we're able to transform what we're providing for the workforce. We're able to increase funding around many of the things that First Five has been supportive of with QCC and thinking about quality and universal preschool access. So that is what's the difference in this range. And ultimately, when we look at this, it's going to take a number of different avenues to fully support this. And actively, since this report has come out, there's been conversations, and you've seen this in the governor's budget with some additional proposals around let's get this started with outreach through philanthropy, with looking for engagement of our private sector businesses. And then I think building on the support of groups like First Five, both at the state level as well as local, to organize, coordinate to, we'll say the big effect overall in this plan, which is again, getting back to the 2030 goals. One thing, and I'll move to this next slide, that we think is in some ways we're designed for this moment, is that many of the things that are in the master plan, which was drafted before the incoming administration had outlined their areas of interest, are things that are highly aligned to what we see in the Biden administration's plan. And you can see a few of those outlined here. And I think what this proves is we as a state are more than ready to be partners to our federal government in sharing in that value for young children, in saying not only are we in alignment on our values, but we're ready to proceed because we have a plan, we have actions outlined of ways that we need to grow our system. So we're expanding paid family leave, we're taking on universal preschool, we're working on our system of funding so that we can structure providing more in the way of support, contribution, compensation to our workforce, and that we're looking for places to put to have facilities adequately available in community for the kinds of needs we see in families. So this is where we will end it by saying, I think we're at a, in one way, an end to the plan, but at a beginning of action. And we're excited to have been part of this journey and look forward to, continuing to see where it grows and goes, in particular with support of First Five.
Thank you so much, Janelle. And I want to see if there are any commission members with questions or comments. Really? Not even one? Okay. All right. Well, hearing none, let's see. Camille, do we have any public comment?
No public comment. Oh, somebody just raised their hand. Spoke too soon.
Hugo Morales.
Hugo Morales.
Yeah, well, this is exciting. Hugo Morales, I'm a commissioner for First Five Fresno. I'm really excited about this plan. I think it's something that I think this year at many First Fives have been talking about, and wonderful that Biden administration's plan on childhood education and child welfare is aligned. And I'm excited about the recognition of the dual language. As we know, in many of our counties, including LA, and I think also the San Joaquin Valley, the majority of our parents are not English speakers, dominant. They're another language. In San Joaquin Valley, for example, is Spanish. So anyway, I commend those who worked on this plan, and it includes Ms. Secretary Perry. So congratulations to her and to the staff to put this together. Wonderful, and the input that you have sought from so many stakeholders. Thank you.
Thank you very much for that comment. Any other public comment, Camille?
Nope, that's it.
All right. And with that, look, we arrive at our close on time. So I think that we are at the close of the meeting. I think we can go ahead and see if there is a motion to adjourn.
Nobody?
I move.
A motion by Commissioner Jimenez, and was there a second by Commissioner Alvarez?
Second.
And I think that is we can call for a vote.
Yes, everybody?
All in favor? Aye. All right, thank you very much. And with that, the meeting is adjourned at 3:57 p.m. It's been my pleasure to serve as my first meeting as chair, and looking forward to seeing you all in April.
Nice job. Thank you.
Thank you.